You see, if you walking in the marketplace, don't throw stones. Even if you do, you just might hit one of your own. Life is not about your policies all the time, so you better rearrange your philosophies and be good to your fellow man. Stop calling me a prisoner. Let him is without sin be the first that cast the stone, Mr. Jailer. Oh, I'm talking to you, Jailer. Stop calling me a prisoner. Let him is without sin be the first that cast the stone, Mr. Jailer. Mr. Jailer. I am a baby say, I wanna be president. I want your money from my government. What he don't know, what he won't know, what he can know. Jailer, Jailer. Oh, be good, oh, be good, oh, be good, oh. Somebody be good, oh, be good, oh, be good. Oh, be good, oh, be good, oh, be good, oh. We don't have to go to 360 degrees. Now it's time we go the 180. You don't have to climb the highest mountains, for all you're looking for is within you. Open the eyes of your mind, your ears and mouth, as I sing my song. Open the eyes of your mind, your ears and mouth, as you hear my words. Oh, ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting, I'll be home. Ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting, I'll be. We still live in yesterday. Many today the waste away, but nevertheless it's never late. Oh, see the times have changed. I thought you knew that these words will never ever wait for you. The world has gone past times of fighting, so drop your guns and your swords and let us live all as one. We all need love and understanding, so drop your guns and your swords and let us live all as one. Oh, ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting. Oh, I'll be. Oh, oh, oh. Across the ocean is more than just a goddess. We all need one another. Oh, oh. Ba-da-da-ba-ba-da-dee, ba-da-da-ba-ba-da-dee. I'll be waiting. I'll be waiting for you. For you, you and you. I'll be waiting for you. Every people, wherever you be. I see you as you leave. I feel it, I see it as you leave. When we kiss, I went deep, but you're far away.
I believe that you are enjoying the light music in the background.
What spell did it cast on me?
I believe that you're enjoying the light music in the background.
You say, girl, never be afraid of ever loving me.
We intend to serenade you with lovely music like this
God, I was a fool.
for
You became my bad
a few minutes
habit.
before we begin the
Keeping
event
up appearances
of today.
so you could notice.
Music is very soothing. Music is good for the soul, good for
Everyone
the ears,
suddenly
and helps us
pick the
relax.
things and left the key.
We'll be spending
That's
ample
crazy.
time together today, and it's important that we are in a relaxed mood ahead of the moment we begin to share together. So please continue to enjoy the music. We are here, we are ready, we are live, and we'll be beginning shortly. Exactly 10 minutes past 10, we are going to begin. So please, till then, enjoy the music. Good music. Good music. We all know that music transcends language barriers, transcends people. Sometimes just the tune, the sound alone can be very pleasing. Sometimes when you hear Chinese music, you don't know what they're saying, but you just enjoy it. Chinese, Portuguese, Igbo, Yoruba, Hausa, everything. We're counting down to 10 minutes past 10. Just a few minutes till we go live. Just a few minutes till we go live. Just a few minutes till we go live. If you know anyone around you who is supposed to join into this meeting, please invite them to join in now so that they don't miss any part.
Every day's not a holiday. My life's like a subway. Oh, I know this love don't last. Look at me, tell me what you see. Do you believe this love is real? Oh, I know this love don't last. I've come from far away to see these go down the drain. I waited patiently, and this is what I get. Emotional
And we're live.
world is giving
in 2019, 18, 17. We're going live very shortly. 14, 13, 12.
If anybody comes to say, oh, I love you, Now you're asking me to trust you. Tell me how am I supposed to when I know
6,
life don't last.
5.
Could it be kind of love
Is it better?
my mom used to warn me about? The CDs go down the drain.
And we're live.
I got
Please stay tuned as we begin today's session.
so emotional, it fell in me. My whole
Hello and welcome to the day 3 of the 2021 edition of the Total Health Trust Provider Forum. We're so delighted to have you here with us today. Our event today is packaged for the movers and shakers of the healthcare industry in the South, South, and Southeast region. So welcome. My name is Victoria Makanjola, and I'll be one of your hosts for today's event. Our theme for this year's event is creating impact in chaos, healthcare resilience lessons post-COVID. Through this event, we just don't want to talk about going through a pandemic. We want to highlight some of the lessons that we have learned from the pandemic, and how in turn we can build better healthcare systems, better healthcare delivery, and in turn a better country. So welcome. Before we begin, I'd like to make some few announcements. Please mute your microphones, please turn off your videos so that we can have a seamless session. Also, if you're having challenges with the platform in which you're joining us, please note that there is an alternative, so you can either join us via YouTube or via the Teams app. We'll be leaving the link to join either of these platforms in the comment section or in the chat box. Also, we're not just dishing out knowledge today, we're also giving out some goodies for facilities. So there is a lucky dip, and how to qualify is we require a representative of each facility, so please drop the name of your facility and the location of your facility in the comment section. One of our executives will assign you with a number. This number is extremely, extremely important, because without this number, you don't qualify for our lucky dip, and you can miss out on some of our goodies. So please do that. Also, our doctors are not left out. We haven't forgotten you at all. We're also giving out CME points for our doctors. All you have to do is go to the comment section or the chat box. There'll be a form to collate your email addresses and your phone numbers. I cannot wait for us to begin. So without further ado, wherever you are, can you do a virtual applause with me as we welcome the CEO of Total Health Trust, Kieran Gordon, for his opening remarks.
Good morning, everybody. My name is Kieran. I am the Chief Executive of THT. A very big welcome to every one of our providers to the 2021 THT Providers Forum. This year, as with most other things, we're obliged to hold a virtual forum because of the pandemic and the existing COVID-19 protocols. Notwithstanding that, I'm positive this will be an exciting, insightful, and rewarding session. The theme for this year's forum is creating impact in chaos, healthcare resilience lessons post-COVID-19. As economies and businesses emerge from the scourge of the pandemic, innovation and resilience become extremely important for growth and sustainability. As healthcare providers, you remain at the forefront of this development. The world is depending on the success and the resilience of the health sector to breathe light into the darkness. And perhaps to return to the moments we all shared freely without physical distancing. These discussions are important to us at THT as they help us understand your challenges and how we can work together to make Nigeria healthier. Excuse me. A healthier Nigeria is good for us all, good for the economy and good for business. Our purpose revolves around this, and you our provider partners are an integral part of this. We have an exciting and informative lineup of speakers and presentations, and I invite you to participate fully in the day. We also have giveaways each day of the forum, and that'll create some fun in between the business. Once again, on behalf of all the management and staff at THT, welcome and enjoy this session with us.
Can we give another warm applause for CEO? All right, so we're going to move right into the business of the day, and we're going to share some brand materials with you. But just to reiterate something that he mentioned, that Nigeria is counting on the health sector to shine light in these dark times. So we're counting on you, we're counting on your resilience, we're counting on your ability to keep going, no matter what the pandemic has brought us. So we're believing in you, we're counting on you. And in this forum, those are some of the things that we would like to highlight. So we're sharing some brand materials now so that you can know THT a little better, you can know what we stand for a little better, and you can get familiar with some of our product offerings. Please stay with us.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why, in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
That's Adamo, our regional sales executive. You can call him a globetrotter. He travels to different cities, closing deals. Today in Abuja, tomorrow in Johannesburg, next day in Sydney. Never fails a day because his health is secured. It's really easy to travel the world when your health is covered. That's what THT does for us with the international health coverage. We cherish our staff, and it's our job to keep them healthy with Total Health Trust HMO while they do what they love. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply. The workplace is bad for, but not for our head of admin, Laolu. With him, there's no dull moment, even when it means attending to so many support requests in a day. Today was quite a workload, and his body seems to be responding with fatigue. It's obvious he needs care, but the closest hospital is quite a distance. Aha! He remembers his HMO has a solution for these kinds of situations. With his smartphone, he had a chat with a qualified doctor using the THT telemedicine app and got his prescription delivered to him. A few minutes later, Laulu is back, ready to take on the world again, thanks to THT. Total Health Trust, working together to make Nigeria healthier. Terms and conditions apply. Amaka is up and running, getting ready for the day. She manages our customer service function every day and she's passionate about it. After another exciting day at work, Amaka is set to go home, but on our way, she starts to feel feverish. She knows she has to seek medical care before it gets serious. With knowledge of THT network of hospitals around her, she alights and walks into a nearby health center and accessed quality healthcare. Having quick access to quality healthcare had never felt better. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
Okay, there you have it. You've heard from us. And now we switch back to programming and the rest of the session for the day. Please stay tuned.
Thank you, Femi. Thank you so much, everyone, for staying with us. Now you know us a little better, so we think that now, we can get into some of the business of today. To set the tone for today and to talk about some of the things that we hope to achieve with this forum, please make welcome with me our head of the Provider Management Unit, Dr. Chiaka Aguboshi.
Good morning, our esteemed providers from the South-South and the Southeast. You're welcome to 2021 edition of the THT Provider Forum. And this is our very first virtual forum, but in the course of the week, we've been interacting with the providers from other regions. We've done Lagos and South-South, Northern Zone, and today is for South-South and the Southeast. What is the purpose of our provider forum? Our provider forum offers us opportunity to interact with our providers, and this helps us to generate useful insights from whatever we get from that, the insights we get from the forum is what we plow back into helping us forge better partnership with you, our providers, while also promoting your interest. And we all know that since last year, that the world has experienced a lot of chaos like we have never had since the last World War. And I'm sure the last pandemic was over a century ago, and we have not witnessed such chaos in our lives before. But this chaos changed virtually everything we did. Changed the way we live, the way we interact with each and every one of us, the way it even changed our personal hygiene, because people now remember to wash their hands regularly. People remember to do things regularly, and we know it has actually changed a lot of things in our lives. And that is why I can term that expression as new normal. We also know that it's actually new normal because virtually everything we do have changed. Even if you go to church, you will see everywhere there is space. And in the light of this, what I've just said, we now created this team, creating impact in chaos, healthcare resilience post-COVID-19. And I'm sure this team is stand perfect for this program. As players of the industry, both public and private sectors, I know we have actually had some positive development that has happened in the midst of this chaos, despite the chaos that we have seen. And those positive developments are things that we have found relevance across board. We have also assembled a lot of resource persons from different sectors of the healthcare industry. And we are all here to learn. And whatever we learn, we implement all this so that we can all navigate from the pandemic and emerge successfully at the end of the day. I just want to mention 3 key words that I want to use for this, and which is very important in what we are doing today. I'll first of all talk about chaos, and I'll talk about impact and clarity. When you say something chaos, chaos means like a state of disorder. You can all agree with me that when the pandemic came, everywhere was in a state of confusion. We didn't understand what to do. Even the WHO does not even, in fact, everybody were all confused. And because of that, everybody thought that things have actually spoiled. We were confused, and we didn't know exactly what. So everybody was all in states of confusion. When you talk about impact, is to have, in the context of our discussion today, impact actually means to have a strong effect on something. And you say clarity. Clarity is being something that is clear, coherent, or you can say easily understood. So I'm sure when I'm talking about chaos and putting clarity, somebody will be asking, what's the relationship between chaos and impact and clarity? I will tell you that there is always, in chaos, what we are trying to talk about today is that whenever you see chaos, you should talk about clarity. Clarity amidst chaos simply means staying steadfast, even when things are not in order. Even in disorderliness, you are making the right decisions. You are taking care of your patients like you have also done. You are maintaining the right attitude. So that's what we are talking about. So there are a few lessons that we at THE have learned, which we want to share with you. At THE, we have also remained steadfast in being your ally, even the through thick and thin. Even the pandemic brought forth our resilience in navigating the chaos efficiently. I'm sure prior to this pandemic, even 2 or 3 months before the pandemic, if somebody have told us that people were going to work from home, somebody will say it's not possible. How can you do that? I'm sure hospitals work from home because there are virtual clinics, and people were also able to see their patients. So those are the ways we're able to navigate from this chaos. Also at THU, we have been able to efficiently conduct various aspects of our services remotely. We have been able to do even claim submission. We did it remotely, and we processed the claims, and providers were paid. We did accreditation and reaccreditations, their reconciliation, and virtually everything we did, we were able to carry them virtually. And in response to the increasing cost of healthcare and healthcare resources and associated costs, we have also reviewed our tariffs since the pandemic and have also remained flexible enough towards addressing fluctuations in costs. We have also maintained the service levels in the healthcare industry. We have also successfully migrated this program that you and I are witnessing today from our usual physical event to a virtual one, in line with universal safety protocol, because putting everybody under a roof, we can go out today and most of us will come down with coronavirus. Beyond the review of tariffs, we went out far in showing love to our providers. I'm sure most of you witnessed that, and because we got a lot of feedback from providers and they were happy by providing personal protective equipment from them all across Nigeria from April 2020 to November 2020. I can bet you that THE spent over 20 million naira for that purpose. So I urge our healthcare providers to please remain steadfast. Make sure you obey the 5 golden rules. Regularly wash your hands. Maintain social distance. Wherever you see people gathered, please don't go there. Make sure you wear your masks. I know a lot of people say, is there a pandemic? What is it? What is that? We don't know. These people they are coming with false information. Please don't look at things that you see on the internet. Go and look at verified information. And when you talk about healthcare resilience, I mean, what we mean about resilience is the ability for healthcare providers to absorb chaos, adapt the lessons you've learned from this chaos, and then continue delivering your services in a timely manner, in the way you are supposed to do that. So we are going to look at some of our resource persons that we have invited today. So while most of them will talk in depth in what our discussions of today, this day, I urge everyone to listen. And again, it's no new that the Delta variant is here. Please, we are in the midst of that Delta wave. We've lost some people, close people that we know, close relatives. And it has also become imperative that we do not let our guards down because the war is not yet over yet. So I just want to drop a final word to our esteemed providers. Like the usual THC events, there are lots of exciting freebies to go home with today. And we are going to have raffle draws, things, a lot of recharge card. Please, I urge you guys to stay well and stay tuned. Thank you.
Thank you so much, Dr. Chianka, for that insightful session. And to reiterate what she said, THC is always here for you. The war is not over, we understand that, but we're going to be with you through it and even after it, so you can really count on us. We're not going anywhere. All right, we're going right into our first presentation of the day. But before I acquaint us with our speaker, I'd just like to remind us that, as she said, we have a lot of goodies to share. We have a lot of goodies for you. This is not just one of those forums. You're going on with a lot of goodies. So please remember that for facilities, there's a lucky dip, and a representative of each facility is to drop the name of your facility and the location of your facility in the comment section. Also, doctors, for your CME points, do not miss it. Please go to the comment section or the chat box and fill our form so that we can have your name, your email addresses, and your telephone number. All right, our very first speaker is Dr. Chukwuemeka Ugu, and I'm going to acquaint us with Dr. Ugu's profile. But before we go into that, if you have any questions, any contributions of any kind, we want to hear from you. This is a two-way communication forum. We don't just want to be talking to you and you're just hearing us. Please talk back at us. Let us know if you are ready. So I'll wait to hear people say that they're ready for me to go ahead with Dr. Chukwuemeka's profile. So please drop a comment in the chat box if you're ready. Let me just hear you say, just drop a comment that I am ready. And then we can go right into it. Do we have comments coming in? Do we have comments coming in? Yeah, we can see your comments. You're ready. So we're going to take a short break before we go right into Dr. Chukwuemeka's presentation. Please enjoy some of our brand materials, and we'll be right back.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from who, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
All right, it's time for us to know a little bit more about Dr. Chukwuebuka Ugu. Dr. Chukwuebuka Ugu is a seasoned speaker, and we'll get to know more of him just in a little bit. Just give us a minute. Apologies for that short delay. Dr. Chukwuebuka Ugu is a Nigerian public health practitioner and researcher. He is passionate about generating local solutions for health systems, strengthening through research and innovative program implementation. Over the years, he has worked in a variety of settings, including at community levels, PHCs, mission hospitals, tertiary hospitals, as well as within the development sector. Presently, he works with the World Health Organization as the COVID-19 Incident Management System Coordinator in Anambra State and a tuberculosis surveillance officer for the state. In his current position, he has implemented impactful interventions in disease surveillance, emergency preparedness and response, and overall health system strengthening. He led the first published population-wide SARS-CoV seroprevalence survey from Nigeria, which was done in Anambra, along with other innovations during the pandemic response at the state level. He is the communications lead for the Christian Medical and Dental Association, where he led the association's Give Hope campaign during the peak of COVID wave. He is a member of faculty at the Institute for Excellence in Healthcare Leadership, a foremost training institute for leadership in healthcare based in Abuja. He currently serves on the board of some local NGOs and CSOs, including Mission to Elderlies, Logos 2 Foundation, and EST UK Academy. An MPH holder from the University of Liverpool, UK, and Commonwealth alumnus. He speaks at international and local conferences and is committed to mentorship. I don't know about you, but I am very, very impressed, and I cannot wait to hear from Dr. Chukwuebuka. Please let's make welcome Dr. Chukwuebuka. A virtual applause wherever you are.
I'm grateful for the very glow. We thank God for the little privileges we've had. It's been great participating in earlier sections of the Providers Forum, and I think within the next 24 minutes or so, we'll just turn our attention to how to create impacts in the midst of chaos. And then we'll try to reflect on lessons post-COVID-19 from the health system. So I wonder if, I'm happy the slides are being shared, but again, it will be a synchrony between myself and the IT team. So what you see, the Japanese sign for crisis, that's the Japanese word for crisis. It's called Kiki. It has two components. The first part is danger, but the second part is opportunity. In other words, the Japanese are telling us that every crisis is a dangerous opportunity. Yes, please.
Hello, Dr. Ogo.
Yes, I can.
Hello, Dr. Chukwuebuka. Can you hear us? Yes. Thank you very much. All right, great. So from the studio here, we will be projecting your slides. So you can let us know when you need to move from one slide to the other so you can have your conversation smoothly with the rest of the audience.
Okay, so yes, I did. Yes, I did.
Did you get that? Did you get that, Doctor?
Yes, I did.
Awesome.
Thank you very much.
Awesome.
So can I be heard,
Over to you
please?
then, Doctor.
Thank you very much. So can I be heard, please? Thank you.
We can hear you.
Okay, so we'll be looking briefly at creating impacts in chaos and trying to tease out lessons for the healthcare system from COVID-19. So I was trying to put the Japanese sign for crisis, that we see under the name. It's a word called Kiki. It has two symbols. The first one signifies danger, while the second one signifies opportunity. Right? So in Japanese philosophy, every crisis is a dangerous opportunity. So and with that sort of opening statement, can we move to the next slide? So I have the following acknowledgements. It's always good to recognize your sources. The Eiffel Institute have put some material from their work, some of the work that was done in Anambra State. Then some material from Dr. Leke Laoye, a few thoughts from a choir in England, World Health Organization, CMD Nigeria, and the Liverpool School of Tropical Medicine. Those are my acknowledgements, plus the two names. Next slide, please. Those are my acknowledgements, plus the two names. Next slide, please. So we'll pursue a rather simple outline. We'll look at the theoretical foundations of health systems resilience. Not just theory for theory's sake, but helping us to think through our systems, be it our organization or our hospitals, using those theoretical frameworks. And then when the color changes to yellow, we'll be looking at different ways of making impact in the midst of chaos. So just giving few examples or typologies of impact. And then when the color changes to blue in the slides, we'll be seeing sort of our personal role. What can I do with the content of this presentation? So that's really like the simple outline this presentation will follow. So starting with the theoretical components, what is a health system? They've defined it severally as organization of people, institutions, and resources that work together to deliver healthcare services to meet the needs of target populations. On the right, you would find the WHO Health Systems Framework. There are different sort of designs for this framework, and in Nigeria, we've tried to add a few things, but countries can modify as it meets their needs. So these are the basic building blocks of health system. So when you think of your hospital, think of service delivery, think of your workforce, think of your information management systems, think of your medical products, your logistics systems, think of financing, and then think of leadership and governance. On the far right are the goals or outcomes of a health system. But I'm asking, has COVID helped us to challenge this definition, for example, or to broaden our mind to what the members of the health system are? So please, can you have the next slides, the next few frames? Yes, keep on going. There are about 4 or 5 pictures that will appear. The next again, next. Excellent, and finally, excellent, thank you. So these are different sort of engagements we had in Anambra State during the COVID response. You will find us responding with the traditional rulers, the religious leaders. The top picture in the middle is in the Palace of Obi of Onisha. And then the last 2 pictures to the right are in the Onisha main market. For example, the extreme right is the main market COVID-19 task force. This task force was so powerful, and in fact, they ensured that every line in the market had a Veronica bucket and an infrared thermometer. And then every shop had a hand sanitizer. And they were so powerful. In fact, in the market, they are more powerful than officers of the law enforcement. So this challenges us to reconsider who we usually think are members of the healthcare system. Is a broader definition that we imagine. Next slide, please. Excellent. So this is a definition of health systems resilience. I've drawn some of the thoughts from the document you see inserted with the link. So health system resilience is actually the ability of the health systems to prepare for shocks, to manage these shocks, and to learn from shocks. Preparing for shocks, managing the shocks, and to learn from it. Managing shock entails absorbing it, adapting to it, and then transforming from within it. And what is shock? Shock is a sudden and extreme change which impacts on a health system. So this essentially is the theoretical definition of health systems. It has to do with preparing your system for potential shocks. I heard that in 2019, I think Fly Emirates conducted an analysis where they say, what will happen if Emirates does not fly for 3 months, I think. So they did all sorts of modeling studies and came out to the finding that they will survive. Little did they know that in the very next year, that they will not even fly for sometimes up to 6 months. A lot of airlines went under. There's one called Flybe. I'm sorry for mentioning names, but actually some businesses went under, you would know. So it's important to prepare for shocks, to foresee them, prepare for them, and then when they strike, to absorb the shock, adapt, and transform our systems. Next slide, please. So this is something called the shock cycle. It shows the 4 stages of responding to shock. Number 1 is preparedness of the systems to shock. Number 2 is the shock onset and the alert system. The system to tell you a shock has started. The system in place, the surveillance system to tell you our supplies are no longer coming. And then stage 3 is the impact management, and stage 4 is recovery. Can you just tap next 4 times for the boxes, explanatory boxes to appear? So next. Next again. Aha, thank you. So preparedness is related to how vulnerable our system is. What if my labor ward midwife goes on maternity leave? How will I survive? So it's assessing the vulnerability of your system, sometimes using disturbances. So a disturbance is a small-scale limiting exposure that can show how vulnerable our system is. And then the focus of stage 2 is to identify when a shock actually starts. So early identification of a shock. That's the focus of stage 2. And in stage 3, the system absorbs the shock and tries to learn from it and transform within it. And then finally in stage 4, there's sort of a return to normalcy. Usually we return to something that is called a new normal, usually after each shock occurs. Next slide, please. So I think the final theoretical framework before we change gears. So this is called the PARA framework. The plan, absorb, recover or recovery phase, and then to adapt to it. So this is a framework that can help us think through our organization. In other words, the stages we go through whenever a shock occurs. So you discover that to minimize the concept, the part of the graph in red, you see that absorption stage in red. To minimize it, performance level needs to have been higher. So the activities we do in the planning phase will decide the length or the depth of shock our system can absorb. And you see how we recover. How quickly we recover also depends on preparedness. And then we can recover to achieve even higher than the level of preparedness that we had achieved earlier on. So this again is for us to consider our system. Where are the weak points in this my hospital? Looking at the building blocks of the health system. Do I have weak points in health workforce? Do I have weak points in infrastructure? Do I have weak points in information management? For example, how many malaria cases do we treat each month? knowing that number, can we then prepare for the upsurge in cases? How many meningitis cases do we treat each month? Okay, since the cases peak in January, February, during that Harmattan heat, how can we prepare with stockpiling spinal needles for lumbar puncture and so forth? This is part of preparedness. It helps us to understand our system and the vulnerabilities of our system. Logistics is critical because, as you have known during COVID, almost 50% of all the medical supplies and products come from one country. That country went to full lockdown during the pandemic. That country is China. So you see, it's affected global supply chain systems. Your hospital may have felt it. To buy commodities, you may have required to pay much more. So these are things that we consider in the stage of preparedness. And if our plan is robust, we can adapt to shock easier. Again, it takes deliberate looking at our services. Look at each component of your service. How do I plan for a shock in this area? I saw a book in another country, in England. The title of the book is How to Open a Post. I don't know if we all heard that. How to Open a Post. In other words, is a book that postal officers, people who work in post offices, read to learn how to open a mail, a letter, a post. The book is as thick as a medical encyclopedia. I was shocked when I saw it. How to open a post. Something as ordinary as that was so thick, like a medical encyclopedia. He went deliberately through step by step. And I say, no wonder some systems are stronger than others, because deliberate effort has been given to planning. Can we go to the next slide? I don't know if IT can help me. Thank you very much. So what are the key determinants of how resilient a system is? Ladies and gentlemen, number one factor is governance. A strong and effective governance is the greatest determinant of resilience of a system. As John Maxwell said, everything rises and falls on leadership. A program that will succeed would have a good governance. So I realized that in this meeting, I help managers from different care providers, and I'm very excited because it is in your table that this stops. Governance should be participatory during a crisis period. This is the time to humble yourself and learn from others. Because in a crisis, things evolve rapidly. Things change so quickly. Initially, we were saying, don't wear masks. All of a sudden, there's evidence that masks will help. Hospitals will need to stockpile masks. So there's need to engage in participatory leadership with a strong vision and regular communication. During the crisis period, people listen to voices they can hear. Not necessarily because those voices have the correct information, but that those voices are speaking. In a crisis, it's not the time for the management of hospital to keep quiet. You don't keep quiet at your staff. You don't keep quiet at your clients, the people we call our patients. You maintain regular communication with them. Number two is financing, availability of monetary resources in the system. So you see, not just that the money is available, but that it is reallocable. We can reallocate it. We can quickly change the direction. We wanted to use this money to build another, but given this pandemic, we are going to use it to stockpile on this medicine, to do this, to hire one or two other staff to take care of this. So reallocability of financing is critical. Number three is resources. And by resources, I mean human and physical resources. They need to be optimal and well distributed. And finally, a very important one, flexibility in service delivery. I was happy when I heard about the THT Medline app, which was brilliant. So during a crisis, service delivery must become flexible, agile, and responsive. E-health, M-health, Who says we cannot consult using Zoom? Patients can all be in a waiting room, and we can have breakout sessions where they meet with doctors one-on-one. There's a need for service delivery to then become flexible during a crisis. Just next slide, please. Just one more tab to put a summary to it. Thank you. So effective governance has been identified as most important factor. After effective governance, the second one is solidarity. Solidarity is that together, everybody achieves more. There are cleaners in your hospital who were always coming first in their primary school. They were coming first in their secondary school, but because they can't see themselves through university, they have to take a job as a messenger, a porter, or cleaner. It has not taken away the natural aptitude God endowed them with. But you will lose those resources if you don't create opportunities to harness ideas from every component of your resources, including your staff. It is the human resources that make nations great, not natural resources. Many countries don't have as much natural resource, but they've been able to harness the human beings they're endowed with, and they're doing greatly. So at this point, I think it's time for us to have a poll. There will be a short question that will appear on your screen, and I would want you to just briefly answer it as honestly as possible. Just a short question with 2 answers as we go. Excellent. So this is the question. As a health manager, what do you think is the most important aspect of your role as a health manager? Is it to keep your staff motivated and inspired, or to ensure that your patients have favorable experience in accessing care from your facility with good outcome? What do you think is your most important role as a health manager? Give maybe a few seconds for us to quickly click on that poll. I think it will pop up for those of you on Zoom, and those on other platforms. You can just drop your answers in the chat room. Oh, I see. Please go ahead and drop your answers in the chat room. Let's just make sure that everyone is participating. What do you think the most important task is? Is it to keep your staff motivated, or to ensure that your patients have a great outcome? You can just put option A or B. Okay, so I think we can move on as you keep answering and reflecting on what it means. I'm mindful of our time, and I think we'll spend 15 minutes, so we move. Next slide, please. I like the comments from 82 Division Hospital. It seems you have aspirated my thoughts already. So IT, please, next slide.
Dr. Chukwuebuka, the slide has been changed. Can you see it?
Oh, no, it's not visible from my end, please.
Can you see it now?
No, not yet. I'm Total Health Trust Limited.
Okay. So the slide is available to the audience. They can see we've changed the slide to the next slide as you have. We're working on monitoring it also so that you can continue with the presentation. But your next slide really impact, identifying opportunities for impact is correct.
Brilliant. So I can go ahead. Thank you very much. Yes. So it's important that we know that, we need to be deliberate and intentional if we must identify opportunities to make impact. And I've put a quote that I got from the internet. It says that if your presence does not make an impact, then your absence will not make a difference. So I don't know the kind of leaders and health managers we want to be. Is it the impactful ones or the ones that will not even be noticed when they leave the scene? So you see, friends, leadership is not just positional, all right? So when I talk about impact, it's going beyond positional leadership to looking at the circumstances in your place of work and how you can contribute, no matter your position. Next slide, please. Okay, excellent. I can now see it.
Thank you.
COVID-19 turned out not just to be a health crisis. It was a very deep social crisis of global proportion. There were job losses, 255 million jobs from ILO estimates, which was 4 times the number of jobs lost during the 2009 global economic crisis. Social isolation and loneliness, severe mental health problems. People were on the brink of losing it. There were uprisings in different countries. Of course, we had our own NSAS. Many countries, United States, Hong Kong, different parts of the world were having riots of huge proportion. And a lot of people suffered isolation. This led to a lot of mental health issues. Some of them were your staff. Some of them were your clients. Could you have reached out to help them? Those are typologies for impact. The person-related impact you make might be more important to a client than giving him the best medicine. Just having a toll-free line of somebody to talk to. And if you look at the next slide, if you can just tap 2 times to show some of the messaging that the Give Hope campaign supported during that period. One more. Excellent. So if you look at that frame on the bottom right corner, WHO actually corrected itself. We now change from social distancing to physical distancing. Because you see, social distancing is the one that can kill. Social isolation is dangerous. So WHO now insists that the correct terminology is 6 meters apart, and that's physical distancing. We should reach out. With a phone in your hand, you cannot maintain social distance. Mental health is an aspect that we usually overlook when thinking about areas to make impact. Next slide, please. Thank you very much. So one of the most important tasks as your manager is to keep your staff motivated and inspired. A lot of managers used to think is to make my patients happy. It's for the patients, it's for the patient's outcome. Well, yes, but no. If you have a motivated and inspired staff, trust me, your patients will have the best time of their life. It is says that, I think somebody asked the founder of Coca-Cola, how does he manage the thousands of people in his corporation? And he says no, that he manages only 7 directors. He manages only 7 directors, and those 7 directors do the rest. So you see, one of the ways of showing relevance in people's life is through finding a way to give to their needs. It may not be monetary. It may be capacity building. It may be giving in other ways. Maya Angelou says that one of the ways giving is so good is that it liberates the soul of the giver. When you think of these concepts, think of the people you are managing. When you manage them well, your patients will have a brilliant time. Next slide. Another area that we can make impact is adding innovation to every aspect of our service delivery. So CMDA were official partners of NCDC during the outbreak, and they reached out to us during the Mask Up campaign that people were not taking up the masks and that they needed innovation in passing the message of masking. So that's why if you look at the right, the first shot there says, don't forget to brush your teeth before wearing your mask. You get why. So that is still the same message of mask, but we try to infuse a kind of innovation to take away the attention from NCDC is telling you wear mask. This person is not somebody is telling you, but somebody is now adding a bit of innovation to tell you that, and people working in hospitals will know this, that it's really important to brush your teeth before you wear a mask. And then they also told us that the young people are not engaging with their messages of masking. So we found a way to engage with mask. And at this point, I need to apologize to all the Arsenal fans. I understand that this is a bit of a sensitive area for you guys. But the second frame there says that if even a face mask with Arsenal logo will still protect you from COVID. So this particular message, a lot of the football-loving young generation engaged with it. This is like premium football banter. Even though we say it amongst, the supporters of the clubs, they know they don't really take it serious, but a message has been passed that no matter a face mask, it protects. So this is about finding innovation, how we can innovate. It might be in communication, it might be in managing the ambulance, it might be in service delivery, just infusing innovation into our activities. Next slide, please. Next slide, please.
Hello, doctor. It's on the next slide.
Yes,
now.
please.
It's on the next slide.
Oh, excellent.
Now. Yes.
Okay, mine is still showing the innovation one. Okay, but the next slide is people
how much you know
until they know how much you care. Excellent. Thank you very much. So I've put in the picture of a gentleman called Leke. He's a resident doctor. And today is the day 28th of a very painful resident doctor strike. And there seems to be some silence about it, and the end does not seem in sight. Leke wants to show care to his patients. He's tired of complaining. What does he do? He gets a table and chair, puts it under a tree, starts attending to a mother and their child. Before you know it, patients grab chairs and line up. This is in the community. And he's making a statement that even though I've withdrawn my services from the public setting, I'm doing it because I love this country, not because I am lazy. I'm doing it not because I am particular about money, but because I see that Nigeria is bleeding doctors. I'm doing it to strengthen the system. So you see, because of that, he has found a way to still render care whilst making the point he's making. I hope participants are able to see the slides, because this singular act of Leke has drawn attention to the plight of the doctors in his community, much more than even the strike itself could have done. And I end up with a quote by Mother Teresa for that slide, which says that we may not all be able to do great things, but one thing we can do is to do the little things with great love. So this is the little tasks that you are assigned to do, putting so much love and heart into it. Even though I can't see the slides, but next slide, please.
On the next slide now.
Excellent. It talks about everyone needs to take personal responsibility for impact in the midst of chaos. There's a quote by John Maxwell there. It says, leadership is taking responsibility whilst others are making excuses. And then I put an African proverb that a communal goat usually dies of hunger. Because people will be waiting, Mazi Chukwuebuka would have given the goat food. Chukwuebuka will be saying, VP East would have given food. Or Dr. Michael or Dr. Okoli would have given food. At the end, the goats did not get any food from anybody. So whenever people don't have a personal stake or sense of responsibility, the task suffers. The goal of your hospital is not achieved. So, and this speaks to, you will observe that we have changed to blue color. So this is now that part saying my role in it. So it says, my personal responsibility for impact. We must, each of us, realize that we must take personal responsibility for impact in our system. Next slide, please. So this is the point where I introduce a concept from resilience to transilience. So resilience asks the question, how can we survive this chaos? But transilience asks, how can we use the opportunity of this chaos to transform this hospital, to transform this organization? You know, before COVID, like I know in WHO where I work, if you're talking about working from home, it's like you're speaking Greek. Supervisors usually feel you want to dodge work. Why are you working from home? Come to the office. We even sign attendance register and all that. You know, but since COVID has come, we are now, in fact, they are now the best people advising, please work from home. And they've seen that we can achieve much more, attend much more meetings. We've attended global conferences from home, presented papers, you know, deliver more, write the same reports we would have written in the office, you know. In fact, for the first time I attended a conference on Twitter. It was shocking to me, you know. So this is transformative resilience. In fact, transilience is a combination of those two words, transformation and resilience. So resilience will prepare for shocks, you know, adapt to that shock, manage the shock, and in a sense, bounce back to normal. When can we return to normal? That's what resilience does. But transilience uses the shock, you know, as an opportunity to transform organizations. It has a futuristic viewpoint. What kind of world will our children live in? What kind of healthcare service will our children inherit? Like a health manager, what kind of hospital will the next manager inherit? It thinks about legacy products. So in essence, it's like bouncing forward, you know, not necessarily bouncing back to normal. So this is a concept we must even apply to our individual lives. Next slide. So as we begin to summarize our thoughts, transforming the health workplace, it might require the manager to use the servant leadership model. It may require it. It is a very transformative leadership model that has been proven. I refer you to the work of Jim Collins. He calls it the good to great leadership model. You can read the book later. To the work of Stephen Covey in his book titled 8 Habits, The 8 Habits. I can also refer you to Mandela's autobiography. It's called Long Walk to Freedom. These 3 books present typologies of the servant leadership model. So servant leadership is simple. This is a top manager showing personal commitment to the lives and outcomes of his subordinates. This is you as a manager getting genuinely interested in the lives of your subordinates, up to the point of even expending your resource if need be. Number 1 is that it unlocks loyalty and commitment. I don't know if you've heard of some terrible leaders, maybe in some countries that we hear. I don't want to mention names, but when you get to those countries, you see the organic love the people love them with. It is because of this servant model of leadership. Even though we call them, these people are bad, but if you go to their people, they have such an organic following. Servant leadership model, it leverages on the power of subsidiarity. Subsidiarity is the latitude to make decisions at lower level. Do you know an ambulance driver can see the necessity to go and pick up a surgeon from their house? But if there's no servant leadership model, if that driver feels that my work is not valued, he can say, no, my supervisor did not tell me to drive by 7 p.m. Let the director of administration tell me when I should go. The head of administration did not tell me to move. They can start pushing that decision upper, you know, and not exploit the power of subsidiarity. You see, friends, servant leadership model can literally transform your hospital. It can transform your establishment. You may have heard that without a vision, the people perish. But I'm telling you today that without the people, the vision will perish. So you see, servant leadership model is a balance between the people and the vision. You know how to push the people, but again, balanced by staying relevant to their personal needs. The picture on the right is a choir of a hospital in England. It's the Greenwich and Lewisham NHS Trust. I never knew that the NHS, the National Health Service of England, organizes choir competitions among the trust. It happens around Christmas. You know, I happen to have been in England at that time of year. And this choir, I think from Wales or so, I'm not sure, they won it for that particular year. In this choir, there are cleaners, there are porters, there are security men, there are professors, there are nurses, there are medical people, there's Nigerians, Asians, all sorts of people in this choir. And it created such a beautiful workplace. And you see, this is one thing that keeps attracting people to work in that place. All these are our internal fights. These people are fighting these people. We are going on strike to fight. All those things do not arise when everybody has a sense of value for their work. It is the leader that should create that environment using the servant leadership model. I was very inspired to watch them perform, you know, and as we wrap up our thoughts, next slide, please. We'll reflect a bit on one of their products. Next slide. Excellent. So you have a short time to serve in that office entrusted to you. You need to make a difference while it lasts. The position you occupy, colleagues, you are not there forever. The average life expectancy of a Nigerian is 19,724 days. I want to ask you, do you know how many left? Of course, people stay more, some stay less, but this is just an average. It's from the World Bank, I think 54.6 years or so. So if you convert it to days, it gives you 19,700 days. So I want to ask you, what are you doing with your 19,000 days? Remember, 1/3 has gone to sleep. I mean, if you sleep 8 hours a day, that's 1/3 of 24 hours. So 1/3 of this 19,000, roughly 7,000 or 6,000 plus, is gone to sleep. So there's that saying that we should work while it is day. Show commitment, show passion, create innovation, make a difference in your hospital while it is day. For the night cometh when no man can work. Don't delay decisions, don't delay innovation, don't delay taking personal responsibility for the good of your system. Work whilst it's day, for the night comes when no one can work. Our days are literally numbered, and what we do with them is completely up to us. Next slide, please. So it may be realizing the human weaknesses, realizing the insufficiencies of our human nature. It may be just a humble acknowledgement of yourself saying, I don't know it all. I need to seek ideas from members of my staff. Remember our concepts of solidarity and community engagement. I need to seek ideas from my clients. I can send out a short survey to my clients. How do you want to be served? All right. And then it can also be acknowledging the ever-present help of divinity in our life. As our King Wumi Adesina said publicly on Twitter, I said, God, as I start my second term as president of AFDB, I humble myself before you. I ask that you will grant me wisdom and that Africa, this is somebody, he has submerged his personal ambition under the goal of the continent and is subscribing the help of God in that person. I think this takes real humility, not just to acknowledge this privately, but to go public despite our high and exalted positions.
Recording in progress.
So you see, colleagues, this is the point where each of us can sit and analyze our lives and look at places where we can make improvements. Whether in preparing for resilience, can I appoint somebody in charge of sexual misconduct so that people who face such challenges can secretly report to the person? Do I have a whistleblowing policy so that we don't wait until there's a huge scandal of sexual abuse or something in your hospital. Let there be a system under the concept of preparedness in place. So as we go to the next slide, I've given about 3 minutes as part of the presentation time so that we can take some time to reflect. Please, next slide, IT. There's something inside so strong. It gives us 3 to 4 minutes to just reflect on what has been shared during the past 22 minutes or so, and make maybe a few notes on where it affects you. I hope IT can just carefully play the song that is there. Is performed by that Greenwich and Lewisham NHS choir in England. And as that is playing, let's reflect.
The higher you build your barriers, the taller I become. The farther you take my rights away, the faster I will run. You can deny me, you can decide to turn your face away. No matter, 'cause there's something inside so strong. I know that I can make it. Though you're doing me wrong, so wrong. You thought that my pride was gone. Oh no. Something inside so strong. Something inside so strong.
The boy who refused to hear my voice, the louder I will sing. The louder I will sing. You hide behind walls of Jericho. My lies will come tumbling. My lies will come tumbling. Deny my place in time. This wonderland that's mine. Our light will shine so brightly it will blind you. 'Cause there's something inside so strong. I know that I can make it. Though you're doing me wrong, so wrong. You thought that my pride was gone. Oh no. Something inside so strong. Something inside so strong. That is insistence. When they insist we're just not good enough. And we're not good enough. And we know better. Just look them in the eye and say, we're gonna do it anyway. We're gonna do it anyway. We're gonna do it anyway. Because there's something inside so strong. I know that I can make it. Though you're doing me wrong, so wrong. You thought that my pride was gone. Oh no. Something inside so strong. Something inside so strong. Something inside so strong.
So colleagues, as we wrap up, it may not be anything so big. It may not be anything huge. It may be the birthday of your cleaner that you call him or her personally, just to tell them that they're a valued member of your team. It may be that your porter's child is sick and you find out how the child is doing. In December of 2008, the professor of my unit, I was a house officer, called me and he told me, Dr. Ugu, I'm happy with you. I'm proud of your work. You are a valued member of the unit. Spoke with me for about 5 minutes and my eyes were filled with tears on the other end. And you see, after that experience, there was nothing I couldn't do for the unit. I would sleep in hospital, even when I'm not on call, just to make sure that nothing goes wrong with Prof's work. I want to encourage you, take personal responsibility for making impact. Next slide, please. Thank you very much for listening.
A big, awesome round of applause once again for Dr. Chukwuemeka Ogu. That was such a wonderful, explosive presentation. What a way to set a tone for the rest of presentations. We really are awesomely grateful to you, Dr. Chukwuemeka Ogu. That was explosive, that was immersive, and that was one of a kind. I'm sure it would still take us a while to recover from that because you have moved us with that presentation beyond just the reason to gather and just discuss on healthcare issues to what makes us share value as human beings, to what makes us connect and be better as human beings. Words will fail me to actually do justice to your presentation, and I will not want to water it down in any way. So just without taking any much of our time, for our virtual audience, please, you've had it all, you've seen it all, you've experienced it all, and you yourself have been part of this. I believe there'll be one or two questions that we might want to ask while we reflect on the bulk of what Dr. Chukwuemeka has shared with us. If you have questions, this is the time to drop it in the comment section. If you have contributions or something you want to say concerning this presentation, please drop it in the comment section. And we will quickly take it for Dr. Chukwuemeka to respond to. Dr. Chukwuemeka, are you still with us?
Oh, yes, I'm here.
Hello,
I'm
Dr.
here, sir.
Chukwuemeka.
I'm here.
Awesome. Dr. Chukwuemeka, just to read some of the comments that we are getting, we have people really excited that they were part of this presentation. And just to read a few to you, Clearview Hospital says, thank you, Doc. I really enjoyed every bit of your presentation. It helps in changing our perspective. That was really immersive, like I said. Another comment says, perfect presentation. Thank you very much, Dr. Chukwuemeka. So many comments. Time will fail us to take all of them, but we will do well to share them with you, Dr. Chukwuemeka. This moment spent with you was really worth it. Please unmute your mic so we can hear you. I guess you're muted. I think you wanted to say something. Oh, great. So if we had a chance, we would like to stay with you and just look at your face and listen to you for the rest of the day up till 2 o'clock and then close with your presentation. But unfortunately, we cannot do that. But take it from us that you will have more time to actually reach out to the rest of our providers through other events that we organize, and I'm sure a lot of people will want to see your presentations, which will do well to share some snippets with the audience. Without taking your time any longer, Dr. Chukwuemeka, thank you very much. Thank you so much for the time you have spent with us. Thank you for the value you have impacted to us.
I am.
And,
thank you very much. I'm grateful for the kind words, colleagues.
We are extremely
I appreciate
grateful.
it a lot. Thank you. Please have a wonderful meeting. And thank you to the organizers for the privilege. Thank you.
Thank you very much. All right, we're back to the rest of the sessions, and that was a good one to set a tone for the rest of our discussions today. As we proceed into the other presentations for the day, please let's listen to a brief recap on talking points from that presentation. Thank you.
Ready. All right, everyone. Thank you so much for staying with us through that session. You'd agree with me that that was beyond delightful. That was such an amazing session. And Dr. Chukwebuka took us on a jolly ride from discussing football to talking about how we can be better people and how we can spend our time better, knowing that every day is a gift and time really is a gift. So what are we doing with our everyday gifts? Are we using it to the best of our abilities? I'm just going to take a few key highlights from his session. There are so many. I could just take a few. So Dr. Chukwebuka started with telling us about the PARA framework, which is that to have healthcare resilience, you must prepare, you must absorb, you must recover, and you must adapt. So the first thing is to prepare. What is going to happen right now if we have another pandemic? So we have to prepare. We have to set our systems for a shock. What's going to happen in our hospitals if there's a surge in the number of cases? So we prepare. And the next thing is to absorb. So the shock is here. We take it in, and we use it to transform. The next thing is to recover. So don't dwell on the shock. Don't dwell on whatever has happened. Learn from it, recover from it. And the final thing is to adapt. So we don't just learn, we become better. So it's not just enough to recover from whatever has happened, how we in turn becoming a better system, a better facility, and even a better country. So that was very insightful. And he mentioned another concept, which is transforming from resilience to transilience, which is a mindset about how do we learn from this and become better. So yes, we're resilient, but are we going to bounce back or are we going to bounce forward? Which is a very important question for us to ask ourselves. And the last thing which he mentioned that I want to dwell on is how we're living every day from an individual's perspective. So not just as a facility or as a provider, but knowing that every day is a gift, and how are we making impact every day, knowing that time is really a gift, tomorrow is really not promised. So how are we using today to the best of our abilities to make a difference? So that was beyond insightful. I know you agree with me. So please drop kind words for Dr. Chukwebuka in the comment section or in the chat box. We'll share some brand materials with you, and some of those goodies that we promised earlier, we'll be sharing them with you right now. So please don't go anywhere. The session continues.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
That's Adamo, our regional sales executive. You can call him a globetrotter. He travels to different cities, closing deals. Today in Abuja, tomorrow in Johannesburg, next day in Sydney. Never fails a day because his health is secured. It's really easy to travel the world when your health is covered. That's what THT does for us with the international health coverage. We cherish our staff, and it's our job to keep them healthy with Total Health Trust HMO while they do what they love. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply. For some people, the workplace is without fun, but not for our head of admin, Laolu. With him, there's no dull moment, even when it means attending to so many support requests in a day. Today was quite a workload, and his body seems to be responding with fatigue. It's obvious he needs care, but the closest hospital is quite a distance. Aha! He remembers his HMO has a solution for these kinds of situations. With his smartphone, he had a chat with a qualified doctor using the THT telemedicine app and got his prescription delivered to him. A few minutes later, Laulu is back, ready to take on the world again, thanks to THT. Total Health Trust, working together to make Nigeria healthier. Terms and conditions apply. Amaka is up and running, getting ready for the day. She manages our customer service function every day and she's passionate about it. After another exciting day at work, Amaka is set to go home. But on our way, she starts to feel feverish. She knows she has to seek medical care before it gets serious. With knowledge of THT network of hospitals around her, she alights and walks into a nearby health center and accessed quality health care. Having quick access to quality healthcare had never felt better. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply.
All right. There you have it. Total Health Trust working together to make Nigeria healthier. And we cannot do that without you, our esteemed providers. And that's why you have the word together. Working together with you, providers, working together with our members, working together with every key stakeholder to make Nigeria healthier. So, as the moderator said earlier, we are going into the first set of freebies for this session today. And how does that work? All you need to do is snap your fingers, get them ready, and pull out your mobile phone. And what are you going to do with your mobile phone? Mobile phones? Some airtime numbers are going to be displayed on your screen very shortly. And the fastest person to load them on their mobile phones get to win the value of those airtime credits. So we have MTN, we have Airtel, we have Glow, and we have 9 Mobile. I repeat again, we have airtime values for MTN, Airtel, Glow, and 9 Mobile. Now, it's very important for us, once you are successful with loading it onto your phone, please indicate your hospital or your health facility in the comment section, as well as the line you were able to load, just so that we are sure that somebody has loaded it. Again, if you were successful with loading the airtime, please indicate the name of your facility as well as the line you were able to load, so that we can let others know that such a line has been loaded, and also we can celebrate you here from the studio. So, are you ready? If your phone is not ready, make sure it is ready. If there are tabs that are open that will make your phone slow, close it. If there's anything that will increase the speed of your phone, close it. Or that will reduce the speed of your phone, close it so that your phone is faster. It's time to drop some bonus airtime on that phone. Are you ready? If you are ready, please drop it in the comment section, and we are ready for you here at the studio. If you are ready, drop it in the comment section that you are ready, and we will roll out live. Are you ready? Are you ready? Are you ready? I'm going to count down from 5, and when I get to the count of 0, you are going to see the airtime values flash on your screen. So I begin now. 5, 4, 3, ready, 2, 1, and 0. Here you go. Fastest fingers, where are you? Fastest fingers, where are you? Whose finger is the fastest? We want to hear winners. It is a testimony to load these airtimes onto your phone. What a way to enter into the weekend. A big testimony. Don't cover your testimony. Share it. One testimony shared is plenty testimonies received. All right? We're waiting for winners. Please drop in the comment section if you're a winner. Don't tell me nobody has loaded our Airtel line, Glow line, MTN line, 9 Mobile. We should have winners now. I know we have very fast fingers there. Calabar, Bayelsa, Enugu, Anambra, Port Harcourt, Aba. Have you winners? MTN, we have a winner. Image Diagnostics is a winner of our MTN line. Awesome. Image Diagnostics, you've shown us your real image, that you are fast and you are precise. You only picked MTN and you made sure you hit correct. Other winners, Glow, 9 Mobile, Airtel. Going. Winners. If you've been successful at loading it, please indicate in the comment section. Very important. Okay. While we wait for the winners, we move over to our second slide of airtime values. A second slide of airtime values. So the first slide is what we are done with now. We're moving over to the second slide. In 5, 4, 3, are you ready? Press consultant, congratulations. You've won the Airtel line. We are extremely excited for you. Congratulations. We move over to the second slide now. In 3, 2, 1, and 0. Here you have the second slide now. Fastest fingers, new set of airtime values, new bumper package for you Image Diagnostics, we're watching out for you. Christ Consulting, we're watching out for you. Consultants, we're watching out for you. Christ Consultants, Image Diagnostics, you are our leaders for today. You are the leaderboard. You are the ones having 5 stars at the moment. We're waiting for others to catch up. All around South, South, and Southeast. Make this happen. Make this happen. Make this happen. Let's make this happen. We know you are all winners. All winners. All up. Every provider on the THT network, we are all winners. We are not average people. We're winners. So let's showcase that even with these small freebies coming at this event. If you've been successful at loading the airtime value, please drop it in the comment section so that we can celebrate you here and others can know that that airtime value has been loaded so they don't keep trying. Winners for the second slide of airtime values. Winners. Any winners? Image Diagnostics. Did you win this? Did you win this? Christ Consultants, did you win this? Did you win this? For those who don't know what to do with the airtime value, what you're supposed to do is to try loading them onto your phone before any other provider or any other participant in this event loads it. So just pick up your phone, go to the line that you use and load it. If you're successful, we would like to celebrate you here. Just indicate in the comment section so we can recognize you and then others can know that someone has loaded the line so they don't try it again. Winners, 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 winners. Somebody must have loaded this line. Don't cover the testimony. Bring out the testimony. Let us celebrate with you. Airtel. We have a winner for Airtel. Clearview Optics. Congratulations, Clearview Optics. We have a winner, a new winner. Clearview. We also have another winner, Penwell High, 9 Mobile. We have 4 people now on the leaderboard. We have Image Diagnostics, we have Crest Consultants, Penwell High, and Clearview Optics. Congratulations. We move to the next slide now while we wait for new winners. The third slide of airtime recharge cards rolling out very quickly in 5, 4, 3, 2, 1, and 0. A new set of numbers, a new opportunity to try out again. Give it another shot. Don't give up on your phone. Don't give up on your phone. You know that song that says, don't give up on God? Exactly. Don't give up on your phone. Your phone can still make you a winner. Your phone can still make you exclaim. The recharge card that you are about to load is not an alert, it is an alarm. When it enters your phone, it does not do ping, ping, it does bam, bam. So don't give up on the phone. Try it out, try it out, try it out, try it out. Awesome, Clearview Optics has won the Airtel line again. Congratulations, you increase your level on the leaderboard. Clearview is clearly the Clearview. They have clearly changed their view to a clearer position. They have cleared the recharge card twice now. Clearview, congratulations. New winners, new winners, new winners. We have other providers all around the South, South, and the Southeast. Everyone can have a shot at winning. Don't give up. New winners. Correctly, congratulations. That's a new entrant to the leaderboard. Congratulations. Yes, I said it. All our providers are winners. We're having new winners per slide, and that is really exciting. New winners, new winners. Any winners? We need more. We have someone who has loaded the Airtel and the MTN. Oh, awesome. Fenwell again. They've joined Clearview at the top view. They've joined Clearview at the top view now. They've loaded the 9 Mobile card once again. Congratulations. All right, and we move to the last and the final slide for this session. We have so many other sessions with these freebies, but we move to the last and final slide for this session in 5, 4. Get ready now. You still have one more chance. 5, 4, 3, 2, 1, and 0. There you go. New set of mobile recharge cards. New set, new set, new set, new set. Give it a go once again. Give it a go once again. Give it a go once again. Don't be fed up. Don't be discouraged. Don't give up on the phone. Don't give up on the phone. The phone can still make you proud. You remember that advert? Papilo, I know one day you go make us proud. That phone can still make you proud this morning. Don't give up on the phone. That phone has served you. You to compensate it with this recharge card. Don't give up on the phone. I believe we have fastest fingers who have loaded this now. Let us indicate in the comment section if you've been successful on Microsoft Teams, on the Zoom platform, on YouTube. Please indicate in the comment section if you've been successful. We'd like to recognize and celebrate you here, and also let others know that that line has been loaded so they don't keep trying. Winners, 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 winners. Do we have winners? New winners. Penwell, where are you? Clearview. Image Diagnostics. We need winners. If you've been successful in loading the airtime, please indicate in the comment section. On Microsoft Teams, on the Zoom platform, and on YouTube. Please indicate. All right, while we wait for the winners to indicate, please do not forget that the sessions are still on. The sessions are still on, and we have one more presentation, 2 more presentations, as well as a panel session coming up. Right now, we're going to proceed to the rest of the event, but before that, we're going to listen to our branded material just one more time, and then we proceed into the next presentation. Thank you.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. Strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
Thank you for staying with us, and I hope you won some of our goodies. If you didn't win, not to worry, we still have many, many more coming. So right about now, I'll just remind us of some of the things that we've mentioned before. Please note that we're giving out goodies to facilities, so a representative of each facility is required to drop the name of your facility and the location of your facility in the comment section. Don't come and then miss out on our goodies. We're begging. All right, so we're going to the next presentation, which is an exciting one. We have Professor Akin talking to us about building back better healthcare delivery post-pandemic. I'll just acquaint us with the professor's work and some of his background. Professor Akio Shibogun is an experienced professor with a demonstrated history of working in the medical practice industry. Is skilled in epidemiology management, global health, healthcare management, and healthcare. He's a strong education professional with a FMCPH, National Postgraduate Medical College of Nigeria, FWACP, West African College of Physicians. Is focused in health, healthcare administration management, healthcare financing. From the College of Medicine, University of Lagos, Columbia University, New York, and University of Zagreb, Croatia. Please let's welcome Professor Akio Shibogun for his presentation. Please a virtual clap wherever you are.
Good morning, ladies and gentlemen. It's indeed a pleasure for me to have this interaction with you. I thank THT for inviting me, and I commend them for having this providers forum. I guess the objective is to ensure that the providers and themselves are on the same page so that you can be able to discuss and negotiate best business in a better manner. I've been asked to talk about improving healthcare delivery post-pandemic in Nigeria. Therefore, I will want to discuss with us how we can build our health system or rebuild our health system following this stress that the pandemic has imposed on the health system. But therefore, my presentation will emphasize the security implication of health and, of course, try to define resilience and sustainability. Resilience is the ability of a health system to recover from shock. There can be no better time to discuss this than now. Because our system has indeed been subjected to a very severe shock. Whether it's able to recover rapidly will depend on you and I. It will depend on what we choose to do to make it more resilient and in future to be better able to stand any other shock that may come its way. And then, of course, the concept of sustainability requires us to look at the resources in our environment and see the best ways by which we can deploy those resources to ensure the delivery of required health services in a way that our economic and social system can sustain for a long time. We look at the challenges facing the health system because that will help us to design the solutions that we will require. Of course, health is at the core of human security, and human survival and good health is the only basis of all other security efforts. As we can see, I think COVID has been a very good teacher in this respect. We can see how the economy was shut down for the larger part of 2020. Not only the economy of Nigeria, economies globally were shut down because communities had to be subjected to all kinds of lockdowns. And in the United Kingdom, you talk about tier 1, tier 2, tier 3, tier 4, and tier 5 lockdown areas. There's no doubt about the social and economic impact of the COVID-19 outbreak. And that is just an example. There are other health epidemics or endemics that have been exerting tolls on our social and economic life. It's just that we've not paid enough attention to them. So if we look at all this, we can see that it provides us with the argument for higher political and budgetary prioritization of the health sector. We need to pay more attention to the health sector. And as I mentioned earlier on, there has not been any better teacher than the COVID-19 outbreak. The only other question is whether we are also good students, whether we've learned anything from the COVID-19 pandemic and its effects on social and economic sectors. We also know that the health of soldiers and populations have determined the course of wars. We know that in Vietnam, malaria was the unseen enemy and it killed more troops than enemy bullets. In fact, it was probably one of the reasons why the Americans had to exit Vietnam, because once the body bags started arriving the American shore, the political support for a continued foreign war was no longer there, and the leadership of the American government had no choice but to, order a withdrawal of American troops from Vietnam. We also know that, of course, the Spanish conquistadors were able to defeat the Aztecs in South America simply because the Aztecs were under an epidemic of smallpox, which decimated their fighting forces and therefore made it easier for the Spanish conquistadors to overcome them. We will just mention briefly that the Spanish conquistadors had the benefit of having learned about smallpox vaccination from an African slave, who had taught them, the use of cowpox. So they protected themselves and were able to conquer the Aztecs in South America. So we can see that health is in fact a security concern. And we know from global epidemics, HIV, SARS, avian flu, they generate enormous fears, panic, and disruptions to socio-economic life, and they've cost countries billions of dollars. We also know that ill health in children, leads to deprivation of knowledge security. So, absence of health security will result in diminished knowledge security, will also affect food security, will affect all other aspects of human security. And ill population leads to poor economic productivity and human deprivation with attendant violence and crime. So it starts a vicious cycle. The United Nations, of course, have realized this, and in 1994, the UNDP annual report, was titled New Dimensions of Human Security, and it established the initial parameters of the field of non-traditional security. Health security was one of the 7 fields of human security that was identified. The traditional security will be looking at only physical security, but now we know that there are other aspects of human life that can also threaten human existence, and security, of course, relates to anything that threatens existence, human existence. And the United Nations Security Council's September 18, 2014 resolution on Ebola, you can see that now health is on the agenda of the United Nations Security Council. So resolution 2177 was the second time that the United Nations Security Council had responded to a health crisis after the HIV/AIDS resolution in 2000, which was resolution 1308, and resolution of 2011, another resolution on HIV on 2011, resolution 1983. The resolution, the Security Council resolution, of course, was as a result of the conclusion that the Ebola epidemic will reverse peacekeeping and developmental gains. Of course, during the Ebola outbreak, Médecins Sans Frontières did request the United States to deploy the military, and on September 16, US President Barack Obama actually announced a military-led response in Liberia. So there's really no doubt that some health issues can really be of security concern. Securitization of health is not a new phenomenon. Outbreaks of bubonic plague in Europe in the 14th and 15th centuries, and rulers of city-states employed military force to carry out draconian disease prevention containment measures. We saw that in Liberia in 2014 during the Ebola outbreak. We also know that a third of the total population of Europe, almost 30 million people, plague caused their death, plague developed into a classic national security concern. Of course, emergence and re-emergence of diseases, increased population mobility, bioterrorism, environmental changes, and transnational crime are all issues that are of concern to us, because it's now easier to have breakfast in Lagos and have lunch in London. Therefore, man in his travels can carry with him all kinds of agents of disease. So it's easier now to spread agents of disease than before. So globally, there has been formed the Global Health Security Agenda, consisting the partners include World Health Organization, World Organization for Animal Health, the performance of veterinary services, and other relevant global health security frameworks. The objectives, of course, were to accelerate progress towards a world safe and secure from infectious diseases, and then to promote global health security as an international priority. So the Global Health Security Agenda action packages are to prevent, detect, and to respond to threats. Of course, under prevention, you have sub-action packages, and under detection, you have sub-action packages, and under the respond item, you have sub-action packages. So to prevent, detect, and respond to biological and other threats to health, a resilient and sustainable health system is required. So a resilient health system is one that is able to withstand or rapidly recover from exposed shocks. And a sustainable health system is one built on local capabilities and realizable local potentials, such that the community can maintain the system at all stages of its socio-economic development. In general, African health systems are facing severe and serious challenges. With just 13% of the world's population, sub-Saharan Africa accounts for 24% of the global burden of disease. This is shown on this slide. The dark areas are those areas that are really undergoing a global health workforce crisis. It is a pity, though, that while Nigeria is one of those countries that are already undergoing the global, part of those countries undergoing the global health workforce crisis, we are not doing enough to retain our health workforce. So we are also witnessing, unprecedented brain drain, in addition to the fact that we don't even have enough already. Well, this is just to support the earlier slide. You can see that Africa is just a tiny dot compared to Americas in terms of health workforce distribution. The global burden of disease is very high in Africa. We can see that the global burden of disease is very high in Africa, and we can see that the global health workforce is very low in Africa, whereas the global burden of disease is even lower in America, in the Americas, and we can see that they have a larger portion of the global health workforce. Well, this is just in support of the earlier comments, so we just move rapidly. The resource deficiencies are an important part of the problem, but may also be compounded by wrong policy choices and weak governance structures. The results in Africa, including Nigeria, in fact, Nigeria is performing worse than countries like Senegal. The results are weak, fragile health systems. Weak health systems make it impossible to attain national health goals and are also a threat to global health security. So if we just quickly look at the Ebola outbreak of 2014, a total of 20 cases were recorded in Nigeria, out of which 8 deaths were reported. Overall in West Africa, 11,300 lives were lost out of about 28,634 infected cases. Excluding Nigeria expenditure, a total of 2.27 billion were mobilized internationally for country response plans, and these countries were largely Liberia, Sierra Leone, and Guinea. Those were the countries that were between the three countries of Liberia, Sierra Leone, and Guinea. 359 million was lost in reduced economic output. That is aside from the funds that were raised externally to support those countries. In those three countries, 5 million children were not going to school due to closures, needs to support households, and the fear of health risks. In Lagos State, Nigeria, with a GDP 4 times the added GDPs of Liberia, Sierra Leone, and Guinea, the estimated loss to the economy for the months from July to October 2014 was 540 million. Remember that the first case in Nigeria was in July 2014, and by October 2014, Nigeria was able to control the Ebola epidemic. But within those 3 months, Lagos State lost about $540 million. And that is aside from the cost of control measures, the cost of sanitizers, face masks, gloves, and personal protective equipment. Those were additional costs. So now to get our health system ready post-epidemic, or more importantly, or more appropriately, to get our health system ready for all times. Let us keep in mind the words of Girolamo Frascastoro some 450 years ago. He had warned that there would come yet other new and unusual ailments in the course of time, and this disease will pass away, but it later will be born again and be seen by our descendants. So our strategic decision should be to prepare a health system that is ready for all times, not just ready for the COVID-19 outbreak, not just ready for this pandemic. Our health system should be ready for all time. So the challenge, therefore, is to develop a health system that is strong for all times. It must have capabilities to meet the needs of the present while anticipating and preparing for the future. So some of the key issues with regards to the Nigerian health system, and this is not exhaustive: inadequacy of health human resources, I mentioned that earlier on, but in addition to that inadequacy of numbers, we also have poor management of even the human resource that we have. So there's relative unemployment of health workers, even in the presence of inadequate number of health workers. So it's paradoxical. You don't have enough, yet the ones that you have are not sufficiently engaged. And then we don't provide the appropriate work climate for the ones we have to motivate them to work, to motivate them to do their best. And that is why doctors and other health workers are migrating out of the country in large numbers. The recent figures published by the UK General Medical Council is really frightening. Each year we are losing almost 800 to 1,000 doctors to the United Kingdom alone, and we are producing only 3,000 doctors per annum. 1,000 is already going to UK. I guess another 500 or more is going to the United States. So we are producing doctors, but we are not retaining them. In addition, of course, there's the increasing interprofessional rivalry due to unclear job definitions. People train for one thing, but they want to perform a different role, which I will refer to as crass opportunism, because the admission criteria for every course is, spelled out, and every citizen is free to go and read and study for the course of his choice. But people go in for one course and then they graduate and then they want to perform other roles. And this has been resulting in unnecessary beauty competitions among health professionals, strong interprofessional rivalry that has been slowing down the health sector further, in addition to the other challenges that the sector is facing. Of course, there's also insufficient public health financing of basic inputs. Over 80% of public expenditure is going into staff emoluments. There is very minimal resources available for capital development and for maintaining the existing infrastructure. So, and in addition, there's weak supporting public utilities, public municipal electricity supply is weak, municipal water supply is weak. So each health facility has to more or less provide all these facilities for itself. It has to provide its own water through sinking of borehole. It has to provide its own electricity through operation of generators. And of course, when the funding is also not adequate, it impacts on the quality of service. So to build a resilient health system, we need leadership and governance, service delivery, health workforce, access to essential medicines, financing, health information system. These are the building blocks of resilient health systems as canvassed by the WHO. But I'll just pick a few of them, because of time constraints, and we'll quickly discuss them. So, characteristics of good governance. If you can ensure public participation, those who are going to benefit from the health service have a right to participate in the design of such health services. They have a right to participate in the management of such health services. So all health facilities will have local inputs into how they are managed, and that will engender, some form of ownership among the members of the public. And the rule of law is also very important for governance, so that the conditions, the guidelines, the rules, everything is transparent, so that workers know how they will be assessed and they know on what basis they will be promoted. That's just an example. So once the rule of law obtains, that will be a good governance, and it will result in better performance of the health system. A health system must be responsive, must be transparent, and must give accounts of public funds particularly, and give accounts of itself in terms of performance, must be able to annually inform stakeholders how it has performed for the year. And of course, the system must be drawn or operated in such a way that it ensures that there's equity and inclusiveness. There must be safety nets for the poor and the disadvantaged, so that they are not left behind. Of course, we must use efficient strategies, efficient methods to deliver the health services. And then in doing all that, another evidence of good governance is our ability to look far ahead in designing our health system. Good governance will produce results that are understandable and acceptable to the governed because of their level of participation in decision making and program implementation. Good governance can be expected to be associated with highly efficient government performance. Well, we'll take a quick look at the health workforce again, because without the health workforce, you can't build a resilient health system. And of the various resources required to deliver healthcare, human resources will perhaps be the most critical. The quality of the human resource will determine how best all other resources are deployed. We need to train, develop, and retain the manpower to make our health system function. You can't expect people to be committed, to be loyal to an organization, to be engaged in an organization, or to want to stay in an organization if the company does not care about them. So it is very important that we care about the work climate, and it is very important that we ensure that we motivate the health workers, so that they can stay and that they can provide quality health services. So we must be prepared, and to be prepared, we need to refine our structures. We need to enhance our disease reporting system. We need to enhance our surveillance for diseases, and we need to enhance our response system. And we need, in this, on a long-term basis, to link academic centers to local and state health authorities, so that we can marry the training and the delivery of services together, so that while people are in training, they're also exposed to practice, so that they can learn from practice. And at the same time, we can leverage on the already trained manpower, the trainers in those academic centers, the specialists in those academic centers, so that their knowledge and expertise can benefit local and state health systems, particularly for research and particularly for disease monitoring and surveillance, so that we can analyze and interpret epidemiological data fast. We must provide enough funds to fund different aspects of healthcare delivery, including research, to provide evidence for decision making, to provide evidence for policy. We must engage our academic centers, as I mentioned earlier on, in this enterprise, so that we can be highly efficient in terms of producing results. In conclusion, a strong health system is better able to prevent disease outbreaks and respond faster in containing outbreaks when they do occur. Investments are required to strengthen the health system, and these investments will only be a small fraction or a fraction of the potential economic losses. So if we don't make the investments now, we will spend far more in containing outbreaks in future. I must thank you for your attention, and I wish you further fruitful deliberations as the forum progresses. Thank you. God.
All right. Thank you very much, Professor Akin Oshibogun. Thank you extremely much for that presentation. We cannot say our thank yous enough, and I believe that every one of our participants online must have benefited from that presentation. Interesting numbers, interesting expose, interesting perspectives, and very insightful highlights for us to take and ruminate on. We are in very unpredictable times, we are in very uncertain times, and it's important that we properly position in any way we can, especially with learnings like these, to have the advantage that we need, but more importantly, work together to make Nigeria healthier. If you have questions for Professor Akin Oshibogun, he is not online with us at the moment because he's had to drop off. Please drop them in the comment section. We will collate it and then we will share with the professor and he will answer and get back to us. Once again, on behalf of all participants, we appreciate the lecture from Professor Akin Oshibogun. Very quickly, just so that we have it top of mind, we're going to listen to quick recaps from that session as we continue with the rest of the event. Thank you very much.
Thank you, Femi. Thank you, everyone, for staying with us. That was such an insightful session by Professor there. So I'm just going to run us through some of the key things that we can take away from that session. Prof mentioned something very important, which is that our strategic decision should be to have health system that can meet the needs of the present as well as anticipate the future. So it's not enough to have a health system that can solve our problems right now. It's great to have health systems that can anticipate tomorrow's problem. So not just the malaria of today, but the COVID of tomorrow. Not just small illnesses of today, but a pandemic that can happen tomorrow. So that should be our focus. That should be our strategic decision. He also mentioned that we have to develop local resources so that we can combat global challenges. We're not going to borrow combat from out of our houses. We have to develop in-house resources to combat global challenges. So that's very important. Let's think of how our country can be better, our states can be better, our region can be better, so that we can combat these global challenges. And lastly, something very important that he mentioned is that there has never been a better teacher than COVID-19, that we should have better healthcare systems. But the important question is, are we good students? Have we learned from this? Would we do better? Or are we just, waiting for another pandemic? So that's food for thought. To continue in this event, please join me as I welcome the Head of Medical Services of Total Health Trust, Dr. Eitayo Abejide, for our presentation.
Good afternoon, everyone, and thank you for staying with us. Thank you since the beginning of the presentation. My presentation today basically would touch on emerging stronger from the pandemic. The pandemic is still very much with us. We're in the third wave, but we have to look beyond this pandemic, knowing that it will certainly come to an end. when we think back to the last major pandemic of that happened like a century ago, apparently like almost 50 million people died, but the pandemic did end. And so in spite of the fact that we're in the third wave, this pandemic would also come to an end. But this pandemic has opened new ways of thinking for every one of us. And every organization first went into survival mode and then started thinking of how to make things better. And same thing for our organization. THC went into survival mode, but we very quickly thought of what to do with the gift of time we had been given, to see how to continue to fulfill our vision of making Nigeria healthier. So lessons we've learned from this pandemic are some of the things I will share today to help us emerge stronger from the pandemic. The first thing I'll advise is that we glance back at the last 18 months. And one of the things we should do is take a hard look at the previous 18 months and look at what worked. How did our businesses survive? What are the things we had to do without? What are areas we had to, in what areas did we have to strengthen? In what areas did we have to strengthen our operations? What lessons have we learned? And what lessons have we learned about the people we work with and ourselves in general? After we've done this, then we'll take a realistic inventory of what we have, what tools we possess, what tools we've gained from the pandemic, and what we still need to be able to work and keep the business running. We have to make sure that we are very honest and realistic about what separates us from competitors. As you must have all noticed, competition has become quite stiff, and patients have moved to, some patients are unable to afford healthcare, and it's the same even with THC. Some of our patients were not able to continue with us. Some patients would have moved to cheaper hospitals, and some patients would have moved because they just did not feel they got very good care at your hospital. But there's competition. Competition is stiff, but we almost keep the business going. Moving on from there, we now have to zoom in and make sure that while we've done all this, we want to emerge not just as a stronger business. Each provider must aim to emerge not just as a stronger business, but each one of us must aim to emerge from this as stronger human beings. During the pandemic, suddenly there was a lockdown. It never happened in my lifetime, and I'm sure it goes for every one of us. We had to sit and in the same space with our loved ones. We had to sit for people that we rarely saw for more than 6 hours a day. We were now with them for 24 hours a day, and it helped us to refocus on our relationships. I'm sure all of you noticed that people jogged more. People that would never jog, started jogging every day. And those things helped us to grow stronger. We should keep that focus, because it's also known that when we're happier with our personal relationships, we also make better employees. It's also important that each of our providers pursue collaboration with providers with similar ideals. So it's not enough nobody has everything in their own facility. I don't know if, even the biggest hospitals we have found, don't have everything in their facilities. So if there's a provider next to you who has a specialist you don't have, you can collaborate. The specialist can finish from their place and come to your place. If there's a provider with an ambulance close to you and you don't have one, this would help all of us to build a healthier healthcare for our members. Moving on from there, like I said, competition is stiff, and each provider has to now look at how to work better and what they would have learned from the last 18 months. But we also need to, when COVID first came, we were all clueless about this respiratory disease that, social media contributed largely to what we know and succeeded very much in confusing all of us. But now we're all better with the knowledge of, at least we know what causes it, we know how it's transmitted, We know that there are vaccines that would at least prevent one from dying from COVID. Doesn't prevent one from getting COVID, but at least it makes the illness mild and reduces the chances of death. And we should educate our members. So I think of it as a corporate social responsibility. We should educate everyone we know about how this disease is transmitted, about the fact that vaccines can prevent severe COVID. Because you notice everywhere you go, people are not even wearing their masks. So you say to yourself, is there COVID really? But there is COVID. And there's no one better able to educate the populace than we, the healthcare professionals. So I want each of our providers on this forum to make it a point to educate each person who comes into their facility about COVID, the fact that it exists, the fact that you can use non-pharmaceutical methods to prevent it, and the fact that everyone should actually take a vaccine except it's severely contraindicated, and those cases are very rare, very few and far in between. We should also make sure that we invest in this business, in our business at this time. Because times are so uncertain and a lot of people have lost a lot of money, people don't like to invest at times like this, but it's been shown that people who invest at the tail end of a crisis, such as the period we are in right now, actually make more money than people who don't. Lastly, I want to move on to the fact that we need to take the lessons we've learned from this time and not go back to our old ways. Now we're ready to put our business in drive mode. We need to forget, a lot of things, plans that people have made did not materialize, but we should move on from there and start looking into the future. Telemedicine has come to stay, and each hospital should embrace digital health solutions. So sometimes when people call into the hospital, you want them to come in because you believe that that's the only time they'll pay consultation fees. But each provider should have a telemedicine arm so that you can actually sift. It's almost like a triage. Decide who needs to come in and who doesn't need to come in. And actually, this will reduce your healthcare costs and make better, efficient use of the resources available. And then, when we had Ebola, we all were very conscious of washing our hands, staying away from people. But in less than a decade, we seem to have forgotten all the lessons we learned. And then COVID came, and we're learning it again. And the truth is, we don't know what next is coming. In 2 years, in 5 years, no one knows. Well, most people have predicted, a lot of people, when they say it, we say things like, God forbid. But there's no telling that there won't be another pandemic very soon. So we must make sure that we continue to follow infection prevention measures so that we all become healthier for it. So once again, we thank all our providers who have been on this forum. Thank you everyone for listening. And we'll continue with the rest of the forum. Thank you.
All right. Thank you, Dr. Abejide, our Head of Medical Services here at Total Health Trust. We really appreciate you for that note, and that was very helpful in building on the foundations we've had from the presenters so far. Right away, we're going to take some of our branded messages, and just to remind us once again of who we are, what we are, and together what we are doing to help Nigeria become healthier. Please sit back and watch this branded material before we continue with the rest of the event. Thank you.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose fuels, purpose drives, purpose enables. At THT, we move and breed our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THT as your reliable partner. strong and kind, resilient and responsible, experienced yet modern. Our purpose is simple. We're here to make you healthier.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
That's Adamo, our regional sales executive. You can call him a globetrotter. He travels to different cities closing deals. Today in Abuja, tomorrow in Johannesburg, next day in Sydney. Never fails a day because his health is secured. It's really easy to travel the world when your health is covered. That's what THT does for us with the international health coverage. We cherish our staff, and it's our job to keep them healthy with Total Health Trust HMO while they do what they love. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply. For some people, the workplace is without fun, but not for our head of admin, Laolu. With him, there's no dull moment, even when it means attending to so many support requests in a day. Today was quite a workload, and his body seems to be responding with fatigue. It's obvious he needs care, but the closest hospital is quite a distance. Aha! He remembers his HMO has a solution for these kinds of situations. With his smartphone, he had a chat with a qualified doctor using the THT telemedicine app and got his prescription delivered to him. A few minutes later, Laulu is back, ready to take on the world again, thanks to THT. Total Health Trust, working together to make Nigeria healthier. Terms and conditions apply. Amaka is up and running, getting ready for the day. She manages our customer service function every day and she's passionate about it. After another exciting day at work, Amaka is set to go home. But on our way, she starts to feel feverish. She knows she has to seek medical care before it gets serious. With knowledge of THT network of hospitals around her, she alights and walks into a nearby health center and accessed quality health care. Having quick access to quality health care had never felt better. Total Health Trust, working to make Nigeria healthier. Terms and conditions apply.
Everyone wants the best things out of life. The best friend, the best partner. At Total Health Trust, we understand partnership. Like friendship, it's about giving and commitment. There is nothing better than having a great partner with a great purpose. Purpose falls, purpose drives, purpose enables. At THT, we something good our purpose, working together to make Nigeria healthier. We cannot promise that life won't be tough, but you can be assured that healthcare can be easy. Whatever life throws at you, you shouldn't have to bother about your HMO. The reason is obvious. We're committed to you. We put you first. We feel what you feel. We walk the talk and show up through the good and bad times. You can count on THC as your reliable partner. Strong and kind, resilient and responsible, experience yet maiden. Our purpose is simple. We're here to make you healthier.
I have dreams for my future and my family. I dream about building my own business. I dream about traveling the world. I dream about watching my children growing up and celebrating important milestones with them. I dream of growing old, content with my spouse. I dream about seeing my grandchildren take their first steps. But life is uncertain, and the health of our loved ones is our only true wealth. What if my child got very ill? What if my spouse needs surgery? What if we had a serious accident? What if we had a challenging pregnancy? Medical cover is so complicated. I'm not sure I would know what medical treatment we could get, from whom, and what it would cost. I wish I could have peace of mind that I can access the care we may need now and in the future. I wish medical cover was easier to understand and easier to access. At Liberty Health, we understand that worry is a thief of joy, which is why in your country and across Africa, hundreds of thousands of people have accessible, affordable, and understandable medical care. They can enjoy the present and have the peace of mind that if something bad happens to them or their family's health, they are covered. From taking care of your everyday health to serious conditions and emergencies, with us, you are covered. Whatever benefit plan you're on, so you can focus on cherishing every moment with your family. Liberty Health, working together to make Africa healthier.
All right, we are back. We are back. Total Health Trust working together to make Nigeria healthier. Working together with you, our esteemed providers, to make Nigeria healthier. Providers from Calabar, from Bayelsa, from Anambra, from Aba, from Port Harcourt, from Imo, from all of the South, South, and Southeast. Extremely happy to have all of you in-house today with us. Now, just before we go into our panel session, we want to have a second session of freebies to usher you into the panel session and to just thank you for staying with us up to this moment from 10 o'clock. How do you participate? All you need to do is pull out your mobile phones, flex your fingers, and it's time to type in some numbers and win big on airtime. Airtime you can use both for call and for data subscription. So, are you ready? Are you ready for this? We have more than enough to give out. We have at least 5 slides of airtime recharge values for all the major networks in Nigeria. And I'm talking about MTN, I'm talking about Glo, I'm talking about Airtel, and last but not the least, I'm talking about Nine Mobile, right? So we have enough airtime to go around, enough airtime for everyone to load. And if you are fast enough, you could end up loading all of the available airtimes for one particular network provider. So, once again, are you ready? Are you ready? How does this work? We're going to flash the airtime recharge values on the screen where you are joining us either on Zoom or Microsoft Teams or YouTube. We're going to flash it on the screen. And if your fingers are fast enough, all you need to do is punch in the numbers on your preferred network provider, and boom, you are a winner of our recharge card values. Are you ready? At the count of 5, the first screen is going to flash on your computer or your screen or your mobile phone or whatever device you are using to participate with us. And be rest assured that if you are successful, please don't forget to type it in the comment section so that we can celebrate your testimony. It's a testimony. I know you'll be wonder why am I talking like this, but it's really a testimony, right? It's not just easy to be the fastest among how many people who are online, right? So please, the reason we need you to type in the comment section is one, so that others can know that the line has been loaded and they don't keep trying, so that their networks don't bar them. And two, so that we can celebrate you here from the studio. All right, without much ado, let's go right into it at the count of 5, 4, are you ready? 3, 2, and 1. Here you have the first screen with the numbers. Here you go. Fastest fingers, fastest fingers, fastest fingers. Where are you, fastest fingers? We don't have all of the time. Fastest fingers, if you are successful, if you've loaded this successfully, please do well to drop it in the comment section so that we can recognize you here in the studio, and also other people can see that those lines have been recharged. Do well to drop it in the comment section. Fastest fingers, Airtel. Fastest fingers, MTN. Fastest fingers, Glow. Fastest fingers, 9 Mobile. Where are you? From Calabar, from Sapele, from Aba, from Anambra, from Bayelsa, from Port Harcourt. Where are you? All our providers are winners. All the providers on the THC network in the South, South, and Southeast are winners. And we want to hear that you have successfully loaded it. All right. We understand that somebody has loaded the MTN line successfully. If you are the one, please indicate your provider name. St. Martin's Hospital. Congratulations on loading the MTN line. St. Martin's Hospital. Kappa Dental Center Services. Glow. Congratulations. Kappa Dental Services. We have new winners from the first session. We have new winners different from the first session. Now, that's great. That's exciting. Kappa Dental Services. All right. Any other winners? Any other winners? Any other winners? Okay, quickly, we go into the second slide. We're going into the second slide. Are you ready? Are you ready? Are you ready? Penwell, congratulations. Congratulations, Penwell, again. You have become winners in this second round. Congratulations. Penwell, you are really showing that you are leaders. You are leaders. You've loaded the airtime successfully 3 times, and that is extremely exciting. So we're going into the second round very quickly in 5, 4, 3, 2, 1, and 0. Here you go. New set of numbers. New set of numbers. New set of numbers. Fastest fingers. Fastest fingers. Fastest fingers. Punch them very quickly. Very quickly. Very quickly. Very, very quickly. Everyone has the right to be a winner on this platform. Every single provider present has the right to be a winner. Nobody can push any other person by the side without being a winner. Everyone has the opportunity to be a winner in this meeting today. All right. Your phone must cooperate with you. Pour holy water on it. Pour anointing oil on it. Your phone must cooperate with you. Twins Clinic. Congratulations, Twins Clinic. You've loaded the Glow line. Congratulations. Awesome. Twins Clinic, congratulations. And Airtel. Wonderful, wonderful. Congratulations, congratulations, congratulations. Okay, we're coming to the next slide now. We have 3 more slides of entirely new numbers. 3 more slides of entirely new numbers, and we want everybody to have the opportunity to win. So I'm going to take one last slide now before I hand you over to our second moderator for today, who will take the next 2 slides, right? I'm going to take one more slide now before I hand you over to our second moderator for today, who will take the next 2 slides for this session, right? So if you are ready, let's proceed to the 3rd slide now in 5, 4, 3, 1 and 0. Here you have the torchlight now. Fastest fingers. Fastest fingers. Fastest fingers. Don't be slow. Don't be slow. You are on the express here. You are on the express here. If you slow down, another phone can jam your phone. Don't be slow. Load as much as you can, as fast as you can, as quickly as you can, as promptly as you can, as swiftly as you can. All right, we should begin to have winners now. Winners of the Airtel line, of the Glow line, of the MTN line, and of the 9 Mobile line. Winners, please indicate. Oh, do we have twins again? Do you want to be twins in this case? You are allowed. Kappa Dental, you are doing well. You are doing well. Beyond dental services, you are also fastest fingers. It's not only teeth that you know how to deal with, you also know how to have fast fingers. Congratulations, Kappa Dentals. Twins, I thought as much. I thought as much. When you hear twins like that, everything a double-double. Everything a double-double. They don't settle for one. Congratulations, Twins Clinic. You are doing well. You are doing well. Awesome, awesome. More winners, we are expecting you to indicate in the comment section. As we proceed into the next slide, I want to invite the next moderator for today. And this person is an MC. It's not like the first moderator that was speaking English. This person is going to take you through some awesome time of laughs, of fun, and be ready to enjoy yourself as we enter into the panel session and bring today's session to a close. So, with a virtual applause wherever you are, please welcome MC No Lele. Thank you. Let the claps roll.
Yes, continue clapping, just keep clapping. Stand up from your hospital table and keep clapping. Good. I can see you. We're talking about Kappa Dentals. You people tried. I think you are more than a dental clinic now. You are an orthopedic. Because your hands are too fast. So well done. Twins, I greet you. You people are excellent people too, because only one group has been able to break the record that Blooming Care, broke the other day. Like I said, Blooming Care, one of their staff built house with our recharge card. She kept winning and winning. As at yesterday, we inaugurated the house. I wish one of you two can build your own next week. So ladies and gentlemen, we move to the next slide. Let's see who the fastest finger will be. So let's do it. If you are there, let it roll. 1, 2, 3, and 4. Ladies and gentlemen, Airtel there, Glow, MTN, and 9 Mobile. Who will win? I expect twins to shout again 2 times. Now, where is the dental clinic? Let's watch you. Let's do it. Who is the first to win? Who can the first be? Let's find out. Press it. Keep pressing. Keep pressing. Keep pressing and pressing until your phone can press no more. Continue. Ladies and gentlemen, who will break the record? I just had a name now. Who can that be? St. Martin's! Woo! St. Martin's Dental. What excellent. Kappa Dental, 9 Mobile. Oh my goodness. You people are doing well. Who will win the MTN? Who can that be? St. Martin's. Oh, we are proud of you. Who again? Who again? Oh my goodness. Twins, are you going back? Are you going back? What are you doing? What are you doing? Do you have so many patients? Please hurry up. Abandon the patients. Please abandon them quickly. Win something. Win something. So, ladies and gentlemen, we have Kappa. Now we move to the next slide. Ready? 1, 2, 3, and 4. Ladies and gentlemen, once again, the ninth slide is on. Who will win? Kappa. We know your place. You are around Kappa here in Palm Grove. Kappa and that battle. You are doing well. Keep moving. Glow. Who will win Glow? Who will win Airtel again? Twins, where are you? Are we saying we only have 4 hospitals in this place? No. Other hospitals, where are you? Jehovah is around medical center. Where are you? Umuezago Community Clinic. Where are you? Hurry up, please. Win something. Win something. Now, if you have not won anything, drop your phone and do what I want to tell you. Kneel down wherever you are. Hit your head on the ground 19 times. 1, 2. Queens! Oh my God! Queens! Twins again! Oh! Twins, you are very wonderful. Yeah, third time, twins! Oh my goodness. You are wonderful. Maybe we'll call you triplets because you have won 3 times now. Yes, you are now triplets. Change the name of the hospital. You are now triplets. Oregon, MTN. Oh, Oregon, Airtel. You are wonderful. You are wonderful. Please, is it that no hospital here has a phone that has 4 SIM cards? You just win the 4 at once. Let's do it. Oh, who can win the last one? The 9 Mobile and the Glow. Who can win them? If you don't win them now, what we'll do is we'll move forward to the next one and the final slide. Ladies and gentlemen, 1, 2, 3, 4. Wonderful, the last one. This time around, when you win, don't just say you have won. Shout. Shout it. Shout it. Put LOL. Laugh it out loud. You know. Put it there, we will know. Ladies and gentlemen, now as you win, talk about THT. Tell the world about us. When our people get to your hospital, before they even bring out their ID card, please give them tea. Make them sit down. In fact, admit them before they even take their vitals. Ladies and gentlemen, make our people feel your presence as hospitals. We love you. Who won the globe, please? Oh my God. Triplets, you have won. No. When it's 4 children, how do we call it? You know, you are no more triplets, you are not quadruplets. Good. Aqua Dentals, MTN, you are coming up. You are doing well. Very, very well. So, ladies and gentlemen, on this note, we come to the end of the fastest fingers in this session. Yeah, nice one, nice one. Okay, we move to the panel where we'll have our discussions. And at this point, I think you don't need to miss it because we have very, very senior people in the field of medicine talking about, you know, the way of life in medicine here in Nigeria and globally. Thank you. Wow, eye clinic Port Harcourt. 5 airtime from Port Harcourt Hospital. Wonderful. Yes, continue clapping. In case you don't know, our viewers, we are in the main bowl of the National Stadium. You can hear the crowd. Now, we move to the panel proper. To anchor this session, we have a renowned medical practitioner, a doctor par excellence, a man of honor, a man whose name rings bell home and abroad. He has studied almost in every country in the world. Ladies and gentlemen, join me to welcome no other doctor than Dr. Ogunkoya Timileyin. Excellent. You can see him on the screen. That's Dr. Timmy Lane. Please wave the millions of viewers watching you. Yeah. Okay. Now, we have another very senior medical practitioner right here in the Federal Republic of Nigeria. She is known home and abroad. She has been in the HMO world for decades, and she has solutions to many, many, many critical issues concerning the world's medicine. Ladies and gentlemen, if you're watching, join me to welcome no other doctor than our own Dr. Adeola Majiagbe. Please put your hands together for Dr. Adeola Majiagbe, all the way from Total Health Trust, a member of the Liberty. Welcome, doctor. Wow, excellent. That's a COVID-19 protocol. She's out in doing it. Okay, we have some doctors joining us virtually. And in case you don't know, I'll bring it to your notice that we have a distinguished doctor and medical director of Queen's Clinic located in Port Harcourt, River State. He is a man of honor, very distinguished in the field of medicine. He is a man whose name rings bell worldwide. Join me to welcome no other person than Dr. Michael Wobu. Dr. Michael Wobu is joining us virtually on this section. Okay. We have a renowned medical director. In case you don't know, some minutes ago, his hospital has been one of the best winners of our freebies. He is a distinguished man of honor. He is the medical director of Twins Clinic and Hospital located in Warri, Delta State. He has attended various local and international trainings in healthcare management, including prestigious leaders in healthcare, providing global health, focusing on health and safety organized by the Harvard X. He is a member of various professional bodies, including, but not limited to, American College of Occupational and Environmental Medicine, ACOM. He also is a member of the Society for Quality in Healthcare in Nigeria, SQHN. He is a fellow of the Institute of Health Insurance and Managed Care of Nigeria, FIHMNI. Ladies and gentlemen, we just mentioned a few of his accolades and acquisitions. Join me to welcome no other doctor than Dr. Emmanuel Egbo. Yeah, Dr. Emmanuel Egbo, we can see you. Please wave to the millions of people watching you all over Nigeria. Welcome, doctor. So, we move to the next medical practitioner who will be joining us. Ladies and gentlemen, permit me to introduce to you the panel ably led and anchored by Dr. Timmy Lane. Please put your hands together for Dr. Timmy Lane.
All right, thank you so much, everyone, for joining. And we must say first and foremost that we are delighted to still be able to have you with us, having spent quite a number of time with us thus far. We want to warmly welcome you once again to the Total Health Trust Providers Forum 2021. And at this point, we want to have conversations surrounding the theme and exactly how much of an impact it is that we've been able to glean over the course of the sessions that we've had so far. And once again, want to appreciate everyone who has stayed and joined us in this particular edition and on this particular day, having started on the 24th, and we have spanned about 3 days. So thank you so much, everyone. And we are also delighted to have joining us Dr. Michael and Dr. Emmanuel in this particular panelist session for this afternoon. Allow me to just quickly set the ball rolling. Without much ado, I believe that we can start off the conversations right away so that we're able to get as much going. Now, for everyone who is joining virtually, either via Zoom, via Microsoft Teams, or via YouTube, I want you to indicate that you are present by putting in the chat section one word that you think describes the pandemic. If you can do that, I'll be delighted, and we'll be delighted to pick up on that, just to be sure that we wouldn't only get your participation when there are freebies, just so that we know we're able to engage and actually have an insightful conversation together. So when you think about the pandemic, I want you to type in the chat section one word that you think best summarizes it. If you can do that, we would actually look out for that feedback, and we would be glad to echo it on this particular platform right about now. Now, okay, so someone said crisis. All right, so we would look out for the feedback. Just keep them coming and just have them flood into the chat section, just so that we know that you are here for not just the freebies, but are actually here so that we can actually have an engaging and insightful conversation. So I'm going to start off with both Dr. Michael and Dr. Emmanuel, and I'll be delighted to get your first take. And I'm going to pick up from one of the words that was just used, which is crisis. And I believe that one of the things that is often said about crisis is that you should never let a crisis go to waste. That is to say that no matter how chaotic it might seem, there is in it gains that we can glean. And so I want to hear from you very quickly, Dr. Emmanuel first, and then we'll take Dr. Michael afterwards. What, in your professional opinion, were the most important gains from the pandemic and the struggle that we have been in thus far?
Bunkoya, for this lovely opportunity.
You can unmute yourself and actually speak to this very quickly. It's your first take, so we expect that you should, as much as you can, keep it brief, and we would continue the conversation further afterwards.
We never knew what crisis it was until December 2019, when we heard about the outbreak in China. Before then, we only read about the Spanish flu of 1918 that spanned almost 2-3 years and took over affected over 500 million people worldwide. Then the world population was about 2 billion. Now we're over 7 billion people, more than 3 times that size of the Spanish flu, and the world has become a global village. With technology, you can be on the other part of the world in less than 12, 14 hours, and it has made the world a whole lot smaller. With this came its resultant effects when this COVID-19 pandemic came out. It means that borders were no longer safe or secure anymore. So far it's been, I can say it hasn't been so bad in Nigeria until recently that we now have the Delta variant that does not have classical symptoms of fever, cough, difficulty in breathing. The virus has mutated to another level. So with this Delta variant, now Nigerians are beginning to experience the true COVID crisis. We hope your program will bring much awareness to your providers on how to handle things. Thank you.
All right, thank you so much, Dr. Michael. Please, a round of applause for him. Thank you so much for those thoughts and those words. So a couple of words have come in. We've had individuals describe the pandemic along the lines of fear, along the lines of crisis, chaos, and how draining it has been. So at this point, I want to quickly ask Dr. Michael, if you're with us, I would like to hear your thoughts as to how, as a health facility, you were able to deal with the exhaustion that the pandemic presented in the space of all of the challenges that you had to deal with. And so, from your own professional opinion, what would you consider as some of the strategies that you deployed that actually helped to ensure that the facility kept on going and individuals were still able to cater to the health needs of individuals that presented?
When I listen to all those speakers, very fluent. Everything is so sweet.
Yes, we can hear you.
But you look
Yes,
at
we
we're
can.
about to
Please go ahead,
connect
Dr.
you
Michael.
now. There was no signal. Everything just like you said, crisis, and everything started. Yes, pandemic is Ebola, COVID-19 is terrible. Really, we were all here. First of all, it was lockdown, social distancing. As my clinic, we followed the protocol, what was from NCDC. We followed it to the minimum. The former presenter spoke. I had to, my staff, I have to rally them and we have to have a conversation within ourselves. How are we going to manage this COVID-19? Either we get it right or we will evolve, we will battle for all the systems. So we always have this morning session, wash your hands, do everything, right from the security, the man in the security, which we trusted, like you said, it has to go down the line. The first presenter, you check this out, make sure that those who come inside there will wash their hands, hand sanitizer, we put a banner, no marks, no entry. And these are the first few things that, all those things, social distancing, mark our seats, don't sit on this one, that is the reception, we give a chance, please sit on this one, don't sit very close to the other. And we have to be doing it every other section, so that, because the patient that comes in is not the same one that came in yesterday. So this is how we started from the initial time. I hope you are hearing me. Yeah. So we went further. This Ebola, this COVID-19 is terrible, really. Challenges, we have to order things in area. When we started having this, the idea the pandemic is coming,
Absolutely.
I started making sure that I had all the drugs stocked somewhere, so that I can lack. And that is what was keeping me on. Okay, it was just collaborative efforts, those who supply you drugs, especially when the time the whole border was locked down, I was making use of what I have in stock for the pandemic. So, and also, Nigeria has a typical way of life. I have to call some of them who will call me on phone, on my cell phone. I want to see you on the clinic. Say, can you tell me what is your problem so that I can make a prescription for that? So, no, I want to see you. Okay, please come, but we must have to be in this thing because your life, my life is also at stake. So we have to follow the protocol of NCC. When they come around, we don't wash your hand sanitizer, put on your masks, and we have a long distance consulting room. You must have some distance away where we live. Minimal examination, okay, but as a physician, I have to. Sometimes you do it, after doing it, you take your hand sanitizer and clean yourself. Am I making sense? Yes. Yes. No. You just have to be a teamwork. And this is what we do every morning.
Dr. Michael.
This is what we do every shift.
I hear you say
Especially the head
preparedness.
of
I
the
hear you say
unit,
compliance
the
to
nursing
protocol.
staff.
I hear you say
your
effective
life, my life,
communication.
the life
I
of
hear you say
that state.
teamwork as well.
It's
That it
either we
wouldn't take just one
comply
individual
or we'll
to be
follow
able to
them.
surmount
So
these
it's
challenges
not a
that
question
we're
of
facing.
who is to do it and who is not to do it. Especially the cleaners, make sure we keep all whatever the cleaning team, the disinfectant, dust, make sure everything is perfect.
Fantastic.
If you don't do it well, don't think you are doing it for me. And it's for your own health and for my own health and for the health of everyone. So please, yes, so that's what we are doing. And then we try to do it once in a week, and that's initial start. Yes. Thank you.
Awesome. All right. Thank you so much, Dr. Michael. A warm round of applause for him. Thank you so much, Dr. Michael, for contributing to these conversations. For everyone who is joining us virtually, it's important that you note that you aren't excluded from this conversation. Please feel free to actually drop your own questions in the chat section, and we will be delighted to actually take those questions as well and post them to our panelists that would actually be glad to address these things. I want to very quickly go to Dr. Emmanuel just before I pitch my tent as well with Dr. Dialama Jagbe right here with me, to just ask very quickly, because one of the things that you said, and rightly said when you were opening this particular session, was how that one of the things that we've seen from the pandemic is that the whole world is now a global village, meaning that, you know, boundaries and, you know, limitations in terms of geography have been clamped down and we can engage virtually. So one of the things that has been topical in the middle of the pandemic has been telehealth, has been about conversations in terms of consulting and accessing health virtually. And Dr. Michael also alluded to this when he was speaking earlier as well. So I wanted to ask you, in your own opinion as well, what you think have perhaps the limitations that we've experienced in terms of penetration of telehealth. Because whilst it's available and whilst it seems to be growing, there also seems to be a drawback and individuals not engaging it as frequently and as intended, bearing in mind the challenges that we're facing at the moment. So I want to just quickly speak to what you think are the limitations in terms of getting telehealth to penetrate into every nook and cranny within our space on this part of the earth.
If I will go into this statistics, I can tell you telemedicine has less than 1% penetration in our healthcare system. The main reason, obviously, is the technology there. Telemedicine needs internet access. You can see just from our Zoom or our Teams meeting presentation how once in a while one speaker goes off air or you cannot find the speaker slide from one of the previous presenters. So in terms of ICT, information and communication technology has been really, really poor. Our internet, although we are at par with the rest of the world at 4G level, even though 5G has already been rolled out, we still haven't gotten proper efficacy. It's not very efficient. Telemedicine would require you having optimal internet connectivity. The second thing will be cost of getting this ICT equipment. Yeah, we know everybody nowadays has a smartphone, has a laptop, but I can tell you, for you to effectively run a telemedicine system in your health practice, you need to be up and doing with good quality IT equipment. Thirdly, it's the mentality of the people. The average patient or client is still not used to you talking to him about his problems over the phone. He feels if he doesn't come to the hospital and have a doctor directly examine him and discuss with him face to face, man to man, he is not being treated. So we have a lot to do in disseminating information that even with telemedicine, you can still have your problem solved in this day and age, especially when there's a ravaging pandemic that needs us to protect ourselves. So I can tell you the mentality of people is still not up to scratch. They are yet to adopt it fully. I set up telemedicine in my own facility over 5-6 years ago and partnered with an Indian company where I get to provide telemedicine services for super specialties that are not readily available in my locality, which is Warri in Delta State. I had the ability to provide neurosurgeons for them, which we did not have, endocrinologists, which were scarce, and all that. When I showed them this idea, they say, doctor, how you going to bring doctor for India to talk to me about my problem here? You know, they never touched me, never examined me. Sorry for my lingua in Warri. Pidgin is our lingua franca, as you may know. Yeah. So at the end of the day, that partnership with an Indian company doing telemedicine actually failed. So with the pandemic ravaging last year, I set up my system again, and sadly, patients were just were not comfortable with them not coming to the hospital for their care. There were issues like, how do we run a test? How do you know what my problem is? Don't you need to do a test? Don't I need to be in the hospital for you to examine me? So we've had a lot of challenges, but I'm sure in the nearest future, with better communication, improvements in our ICT technology in the country, telemedicine will pick up and the penetration in the healthcare system will surely improve. Thank you.
All right, fantastic. Thank you so much. Thank you so much, Dr. Manuel. We really are delighted. We believe that the conversations are moving and we're able to take a thing or two away from some of the thoughts that have been shared so far. Rightfully said, Dr. Emmanuel highlighted the role of personal touch and that cultural inclination that we have to actually have a doctor, examine us physically and things along those lines. At this point, I would also like to turn the table over slightly a bit to Dr. Deola Majiagbe to also further these conversations that we are having this afternoon.
Thank you, Timilane. Thank you so much. We're really glad that our panelists are here with us and for all our participants from the South, the Southeast. I just want to turn to Dr. Michael. You had said something about the morning meetings, So I just wanted you to highlight because resilience really is also about preparedness. Apart from those morning meetings that were like a platform of being able to communicate widely and being able to implement the different infection prevention protocols and other things. What other things would you consider as part of your leadership and governance within your facility were helpful, like they contributed to your preparedness in order to be able to withstand the epidemic? I know you had talked about stockpiling of medications, which actually helped your, the supply chain at the point where the borders closed. I just wanted you to highlight the fact that it's important that you are prepared as an organization for shocks at any time, and not that we just continue to go from day to day as though nothing will ever happen. And I think that is the idea, that these crises will come from time to time, but that when we have good leadership, when we have those building blocks of preparedness, it stands us in good stead to withstand, to absorb, and to manage and recover from these shocks. So I just wanted to highlight a little bit more. What are those characteristics of Queen's Clinic that you could just take us a little further into, that were your practices before COVID hit, and you could really say that these helped you to put
Thank you very much. Thank you. Just like what Dr. Chukwuebuka very, very enlightened, like if we were what we were doing. If you attend some conferences, international conferences and all the rest of them in some section, where they highlight to you what to do as a private medical practitioner, what you are going to do. And when you come back, you apply this to your system. Okay? So but you see, it's an evolving disease that came in, nobody really know what was happening. The protocol continued changing. And then all you need to do is to organize your staffs. Leadership, yes, you also have to lead. Make sure you are not the boss. Because like we learned in the medical school, if you don't take care of yourself, it's either you acquire it or you go with the people who are going. So you letting them have it themselves that you have to do it yourself. Not that you are working for Queen's Clinic or you are working for me. You are doing this for you to survive, so that at the end of the day, whatever we have, you are still living. Your family is still living. So we code it across. We do it a session. Sometimes I'll come as a medical director. I'll go down, make sure that everything is okay. Then stockpiling is essential. Even till today, I do that. I buy in bulk, because you don't know what will happen next time. Look, take example now. Infusions are just so scarce. That is critical thing. IV infusions. Rarely you find them. I don't know what it happens in other area, but here in Port Harcourt, difficult. But you see, even if you have the supply, you continue ordering. You continue ordering 1, 3, 4, so that such things you can never lack. So that is something applied to even the common drugs we use. You don't wait till your stock is zero before you order. You continue ordering as far as there's money to pay. That's why I say it has to. Some of us worry when you are not paying us, we are just so worried. How do we continue? So we continue worrying you, pay our bill, pay our this thing. So that thing is essential for this time, and we will continue. I started it right from the beginning. If I don't have the money, I will tell you supply me in bulk on credit, and I will